that has not increased since 2007 falls short of the loss, trauma and long-term financial impact this has had on the families. And can the Secretary of State please explain why this one-off payment hasn't been inflation adjusted, and will he commit to reviewing its adequacy and fairness?
I thank him for his question. The vaccine damage payment scheme is not a compensation scheme. It's really important to state that now. It is a one-off payment. As I've said, we recognise there are concerns that campaigners have raised, and their input is shaping our ongoing consideration of reforms to the scheme. But I would state that, you know, all vaccines in the UK are authorised by the MHRA. It's an independent body recognised globally for its high safety standards, and this Labour government bases its decisions on scientific fact, unlike Reform, who still haven't apologised for platforming dangerous anti-vax conspiracy theories. And I can only assume, Mr Speaker, that they are less interested in protecting people than they are in alarming folk for political advantage.
Sean Davies.
Number 2, sir.
Secretary of State.
Thank you, Mr Speaker. This government has invested an extra £26 billion in the NHS, delivered 5 million more appointments in our first year and cut waiting lists by over 200,000. And we're tackling the NHS postcode lottery. Patients shouldn't have to wait longer for worse care because of where they live. Our new NHS league tables are shining a light on the poorest performers, so they receive the extra support and accountability needed to turn them around. The best leaders are being sent into the most challenged trusts to turn them around. Failing managers will have their pay docked, and persistent failure will lead to restrictions on boards, as we saw in Leeds this week. We won't tolerate failure.
Sean Davies.
For the wider Shropshire, we know that the NHS has an absolute mountain to climb after years of underperformance, and we've begun that journey with falling waiting times, increased government investment and plans for Telford's first ever cancer treatment unit. Will the Secretary of State ensure that those trusts that are showing signs of improvement are backed to catch up with the rest and then continue their improvements, particularly with investment around technology, research and infrastructure?
Absolutely, Mr Speaker, and my honourable friend deserves real credit for championing Telford and Shropshire and helping to get the trust the investment it needs. He's right that local services haven't been good enough for a number of years. We're not going to turn a blind eye to that failure. We're going to do something about it. There's a long way to go, but we've already delivered an extra 94,000 appointments and cut waiting lists by over 14,000 at his local trust since the general election. So a lot done, but lots more to do.
Joe Robertson.
Speaker, I see the Health Secretary as having a bust-up with the Chancellor over who pays for his £1.3 billion redundancy bill for breaking up NHS England. Can he guarantee that when he has resolved his differences with the Chancellor, not a single penny will be taken from delivering frontline health and social care services or from underperforming NHS trusts in order to pay for making staff redundant?
Mr Speaker, he shouldn't believe everything he reads in the newspapers. And also, I make absolutely no apology whatsoever for trying to cut unnecessary bureaucracy in large national organisations to redeploy savings to frontline services. His government really should have taken a leaf out of our book.
Thank you, Mr Speaker. Mr Speaker, the Minister needs to look no further than Homerton Hospital in Hackney for good performance. It's managed to increase productivity by over 11%. So what's the Secretary of State doing to support great leaders delivering great progress and making sure that they've got the funding they need to continue on that?
Thank you, Mr Speaker. I was delighted to meet with my right honourable friend only recently to hear about the really impressive productivity gains being made at her local trust. I'm keen to learn more. We need to incentivise leaders and reward leaders for that kind of outstanding performance, and we also need to get some of that best practice to some of our poorest performing trusts.
Van Malen.
Thank you, Mr Speaker. Oxford University Hospitals Trust is one of just 3 through the early access programme. Last week, I attended a roundtable where one of my constituents attended, Alex, advocating on behalf of his son Ben, who isn't getting the treatment. We discussed lessons learned from this early access programme. Will he meet with me, Duchenne UK and the APPG for access to medicines and medical devices so that we can share with him those lessons?
Mr Speaker, I have had the privilege of meeting some of the campaigners and particularly the young people affected by this cruel condition. I understand the frustrations he has. I know that the medication itself is being put through the NICE process. I hope that will deliver a positive outcome, and I'd be delighted to keep him apprised of progress.
Can I just suggest to members, when they look at the question, it should be related to the question. Please, it will be helpful. Right, let us go to Shadow Minister Dr Luke Evans.
With reports of over £1 billion in costs for ICB redundancies, and the CEO of NHS England warning that services could have to move to Plan B, could the Secretary of State set out what Plan B is?
Mr Speaker, we are absolutely committed to delivering the transformation that we've outlined. We're working with ICB leaders and NHS leaders to do that in a timely way. Those savings will deliver better value for money and will enable us to redeploy resources to the front line where they belong.
Dr Luke Evans.
I thank him for his answer, but waiting lists have risen for 3 successive months now. Doctors are on strike, GPs are in formal dispute with the government, and the ICBs are cutting 50% of their staff and don't have £1 billion to pay for it, all while their NHS 10-year plan has been published, but with no delivery chapter. When will the Secretary of State come to the House with a delivery plan for the NHS 10-year plan?
Mr Speaker, not only have the Conservative Party failed to get in the news, they've clearly not been reading it either. There have been no doctors' strikes in the NHS since before the summer. We have been sat down with resident doctors and their new leadership to try and avert future strike action. He is right to point out that the action taken by the previous committee, unnecessary and irresponsible as it was, has impacted on waiting lists in the last few months, as have higher levels of demand than anticipated. I say that by way of explanation, by the way, Mr Speaker, not by way of excuse. I'm determined to make sure that we hit our target as outlined in the government's plan for change. I think you'll find in the coming months we'll be back on track and well on our course to achieving something that the Conservatives failed to do when they had the chance.
Question number 3, please, Mr Speaker.
Secretary of State.
Thank you, Mr Speaker. I'm deeply concerned by the state of maternity care we inherited in the NHS. That's why I've asked Baroness Amos to chair an independent investigation into NHS maternity and neonatal services. Families deserve truth and justice. There must be accountability for failings and services must improve. I'm committing to doing whatever it takes to provide patients and babies with safe, comfortable and dignified care. And Mr Speaker, I should inform the House that this week I've announced there will be an inquiry into failings at the Leeds Teaching Hospital Trust. I'm working with the families affected to agree chair terms of reference, and I'll keep the House updated on next steps.
Samantha Niblett.
Thank you, Mr Speaker. Pregnancy can be a worrying time for any expectant parent, and knowing they can access their GP to see a person face-to-face is hugely important, something that was denied to my constituency Hayley Johnson, who sadly went on to lose her baby Evelyn when she was delivered in an emergency at 26 weeks and 6 days due to a huge misdiagnosis given over the phone. So with regards to maternity support specifically, what is the Minister doing to ensure excellent maternity care is delivered within local communities so that this never happens to another family, and when the very worst thing does happen, that parents who are suffering at the loss of a baby, that support also extends to bereavement counselling?
Firstly, can I thank my honourable friend for the work she is doing to campaign for better support in this space, and the tragic cases she raised, not just today, but in her very powerful contribution to last week's debate too. She's right that GPs are critical for supporting women during pregnancy, providing compassionate physical and mental health care and signposting relevant services, which is why continuity is important. I'm happy to report to her in terms of mental health and bereavement support, a record number of women access to specialist community perinatal mental health service or maternal mental health service in the 12 months to July 2025, but clearly there is much more to do. We've announced a £36.5 million package for bespoke perinatal mental health and parent-infant relationship support as part of the continuation of the Family Hubs and Start for Life programme. But as we saw and heard in last week's debate, a lot done, but so much more to do.
Joshua Reynolds.
Thank you, Mr Speaker. Safe maternity care depends on adequate staffing. We on these benches have been calling for better recruitment and retention of staff in women's health services for a long time now. So could the Secretary of State outline what specific measures the government is taking to address the shortage in midwives and the specialist neonatal nurses that we need across England?
We do need to make sure that there is better staffing and we've got the right people in the right place. I should just caution the House, though, Mr Speaker, that what we've seen in recent years has been an increase in staffing, but not a corresponding increase in the quality of care. So we do have to make sure we're looking at this in a nuanced way. It's about having the right staff in the right place at the right time to deliver safe maternity and perinatal services, and that's exactly what we'll do.
And the Morgan Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. Our maternity wards are in a state of crisis, with death and injuries rising at an alarming rate. Sadly, this is not an issue that was confined to Shropshire, and there has been a steady drumbeat of maternity scandals, with review after review finding consistent failings across the NHS. So can the Secretary of State explain to me and the many mothers I have personally met who face tragedy and unacceptable trauma why the government is cutting National Service Development funding, ring-fenced funding to improve maternity care by more than 95%, and why the immediate and essential actions from the Ockenden review into the failings at Shrewsbury and Telford Hospital Trust, which were to be implemented nationwide, are still not in place more than 3 years later.
Mr. Speaker, we really aren't. What we have done is devolved funding and responsibility locally, which we think is the right thing to do. And if I may say, it's actually quite irresponsible to suggest that maternity funding and funding for services has been cut in the way that the Honourable Lady just described. I think it causes unnecessary concern. We are taking into account the recommendations made by Donna Ockenden, as well as a wide range of other reviews and inquiries as part of Baroness Amos's rapid investigation, because I, like the Honourable Member, want to see rapid improvement in maternity services across the country.
Neil Duncan-Jordan.
Mr. Speaker. Thank you, Mr. Speaker. Children's hospices provide crucial support, but for too long they've faced the cliff edge of annual funding cycles. I'm really proud then that we've provided certainty with a 3-year funding settlement of £80 million, giving children's hospices the stability and predictability they need to plan properly and focus on caring for seriously ill children and their families and loved ones. I am sure that the Honourable Member will join me in welcoming the certainty that we have delivered for the sector.
Thank you, Mr. Speaker. I absolutely welcomed the government's announcement last week that funding for children's hospices will be extended for the next 3 years and will rise in line with inflation. And Julia's House is one such hospice that serves families in my constituency of Poole. However, children's hospices still face challenges in accessing funding from local NHS bodies and councils, addressing workforce shortages, and holding ICBs to account for the way in which they commission children's palliative care. So what reassurance can the Minister therefore give that children's hospices will benefit from sustainable financial support both now and in the future?
Well, I thank the Honourable Member for that question. I am delighted that Julia's House Hospice, that he refers to, received £525,000 from the allocation. I'm sure that was very welcome to the staff and the families. It's also worth noting that out of the £100 million allocation that we made to capital funding, 12 million of that went to children's hospices, so that's an increase on top of what we've just been talking about. So, of course, there are challenging times from the point of view of funding, but there is also a huge amount of certainty and stability that we've provided to the sector.
This funding is welcome, but hospices like Mountbatten in my area are still making cutbacks because of the budgetary choices that this Chancellor made and ICB practices. This is a multi-year funding settlement, but multi-year funding settlements need to be longer. So will the Minister look and commit to including all hospices in a longer multi-year funding settlement for stability in the sector?
Mr. Speaker, I do find it quite extraordinary that members opposite come here and lecture us on the sustainability of funding, given the way in which they crashed the economy and left us in a dire fiscal position. I would have hoped that the member opposite would welcome the fact that rather than the annual funding cliff edge that they left for vital children's hospices services, he is now criticising us for moving to a 3-year funding settlement. It beggars belief, Mr. Speaker.
Steve Darling.
Question 5.
Minister.
Thank you, Mr. Speaker. The Conservative government's promise of 40 new hospitals by 2030 was a fantasy with no funding beyond last March. In January, we published a realistic plan which put the programme on a credible and sustainable footing. We're committed to delivering all the schemes in the programme and are moving at pace with funding in place for design work, construction activity and business case development.
Steve Darling.
Thank you, Mr. Speaker. And the Conservatives still haven't apologised for the appalling state that they left our NHS in. Torbay Hospital is the third oldest hospital in the United Kingdom. It has a tower block wreathed in scaffolding that stops bits of it falling off rather than being under repair. It has sewage leaks throughout. Sadly, it needs significant investment that's being kicked into the long grass. The senior manager only described their situation as dire this week. Will the Minister meet with me and representative of the hospitals to explore how we can achieve the investment to turn this round?
Yeah. Well, he makes an excellent point that was echoed by Lord Darcy in his report about the state of our hospitals, and I know many honourable members have got similar problems, and I have visited many such hospitals, and will be happy to discuss this with him further. I remind him that, of course, the Torbay and South Devon NHS Trust has been provided with £7.3 million from the Estate Safety Fund for works at the hospital, and we're absolutely committed to making sure that it will be developed in line with the programme.
Rebecca Smith.
Thank you, Mr. Speaker. Yesterday I met with Leela, a sixth form student at
Mr.
Speaker, number 6.
Minister.
Thank you, Mr. Speaker. We are putting the final nail in the coffin of her party's disastrous Lansley 2012 reorganisation. So bad that it made me become an MP, Mr. Speaker. We are abolishing the world's biggest quango, NHS England, along with 200 other bodies. The question is, why didn't they do that when they had the chance?
Thank you, Mr. Speaker. Yesterday I met with Leela, a sixth form student at Coombe Dean School, who raised the issue of long waiting lists for mental health services for children and young people across Devon with me. So what action has been taken as a result of the government's policy of reorganising the NHS to reduce the unacceptable delays in mental health diagnosis and treatment for children and young people, particularly in constituencies such as South West Devon?
We know that the state of mental health services, and particularly for young people, is something I think as all constituency MPs we are fully aware of, which is why my honourable friend is working at pace to commit to our manifesto commitments to support people, particularly through schools. We also understand the difficulties, particularly her ICB has with its financial situation, something also we are targeting as part of our reforms to make sure that they do develop services for local people in line with the expectations we have set them.
Rachel Musk.
Thank you, Mr. Speaker. Likewise, in York, CAMS is just not working for children that left on waiting lists and often with no management or treating. In order to really see reorganisation in our NHS, would our government look at local authorities commissioning mental health services in order to deliver those and meet the holistic needs of young children's development and mental health well-being?
Well, again, I echoed, as she has the state of those mental health services. We are, as I said in our manifesto, committed to those 8,500 extra mental health support workers in her local area. It is important that commissioners work closely with their local authorities on part of mental health service, and I know my honourable friend is making sure that that happens as part of the reforms we're undertaking.
Dr. Caroline Johnson, Shadow Minister.
Mr. Speaker, I'm concerned that the disruption caused by an uncosted, unplanned, simultaneous reorganisation of NHS England and the ICBs is affecting patient care. Before the summer, the JCVI recommended that the RSV vaccine should be given to those over 80 and those in adult care homes. In July, I asked the Secretary of State to confirm this vaccine would be available in time for the winter season, and he said, I quote, "I can certainly reassure the Shadow Minister on this. The winter vaccine programme started 3 weeks ago. Why has he not delivered on his promise?"
That's exactly
just from my honourable friend speaking here, we have delivered on that commitment. I mean, she talks about the reorganisation being a distraction. If her party had focused taxpayers' money on patient services rather than a babooning bureaucracy with costs increasing both at providers and through ICBs, we wouldn't have inherited the mess that we have, and we'd be able to roll out programmes more effectively. But we have committed to that.
Dr. Caroline Johnson.
I thank the Honourable Lady for her answer, but I would like her just to check and perhaps update the guidance to GPs and the websites, which continue to say that it's only available to 80-year-olds who are 80 after the 1st of September 2024, which is not all people over the age of 80. Mr Speaker, reorganisation is affecting delivery elsewhere too. The Secretary of State also promised that the continued rollout of fracture liaison services would be one of his first priorities. Can he tell the House how many new fracture liaison services have opened since the general election?
Well, on her first point, as ever, this government actually, unlike her previous government, does believe in experts and we follow the clinical advice that we are given. On the second point, the commitment, just as she's so keen on reading our manifesto commitments, was by 2030. It's currently in 2025. Our reforms to ICBs and providers, bringing the NHS England inside the Department of Health to make it more democratically accountable for taxpayers, will reverse the shocking increase in funding that they made into a leaky bucket. We are fixing the foundations of the NHS. We are targeting resources on people in line with our 10-year plan.
Question number 7, please, Mr Speaker.
Minister, well.
Mr Speaker, the NHS Online Hospital will connect patients with clinicians anywhere in England through the NHS app. It will deliver up to 8.5 million appointments in its first 3 years, 4 times more than the average NHS trust. Bringing the NHS finally into the digital age, we are cutting waiting times and providing patients with more choice and convenience.
Natasha Irons.
Mr Speaker, the well-being of our nation's young people remains in crisis, with 1 in 5 of them having a probable mental health condition and the number of being referred to emergency mental health care continuing to rise. And in communities like mine in Croydon East, where young people are waiting months and sometimes even years for help, families are desperate for support. So can the Minister outline how NHS Online will help young people access the mental health support they need? And what impact will it have on reducing the waiting times for children, adolescent and mental health services?
Mr Speaker, I thank my honourable friend for bringing this crucial issue to light. Early access to high-quality support is critical for young people struggling with their mental health. This is backed by us with an extra £688 million this year. We're hiring more staff, expanding support teams in schools and boosting support in new Young Futures hubs so children can get the best possible start in life. Although initially not focused on CAMS, the scope of the NHS Online Hospital is a personal priority for the Prime Minister and has the capacity to grow, and we will consider incorporating when safely able in the future alongside other services.
Seamus Logan.
Thank you, Mr Speaker. Whatever about the impact of these new online services, as the opposition front bench have drawn attention to the fact that waiting lists in England have risen for the last 3 months. And I can inform the House, Mr Speaker, this morning that waiting lists in Scotland are coming down. Would you like to explain why this is the case?
Mr Speaker, I'm so glad the honourable gentleman took the time to ask that question, because while we invest in digital services, Scotland and Scottish patients are still waiting for the most basic digital infrastructure. While we invest record amounts of funding into Scotland's budget, their excuses keep rising. What he needs to answer is why Scottish patients are living in a digital desert, while patients in the NHS here in England are getting more and more sophisticated NHS digital services.
Dr. Ryan Sullivan.
Question 8, please, Mr Speaker.
Minister.
Thank you, Mr Speaker. This government is investing an extra £26 billion in the NHS, opening up community diagnostic centres at evening and weekends and delivering 5 million more appointments to catch cancer earlier. We are making progress. Already 135,000 more patients have had cancer diagnosed or ruled out within the 28-day target compared to the previous year. A lot done and a lot more to do.
Sullivan.
A local teacher went to her GP with clear symptoms of a facial tumour that told it was simply the effects of age. It took almost 2 years to receive a confirmed diagnosis, including 8 months lost in the system after an urgent referral. Does the Minister agree with me that reducing time for cancer diagnosis must start with strengthening systems to support early recognition and follow-up, and that no one is left waiting? And can I also add and wish the Minister well with her own cancer battle and thank her for bravely sharing her experience of living with cancer?
I thank her for her question and her well wishes. We are taking cancer detection seriously in general practice, and there is work to do. It's why we've recently launched Jessie's Rule. It's a patient safety initiative that means when patients return 3 times with worsening or undiagnosed symptoms, GPs must reflect, review and rethink, and that could include a second opinion, episodic continuity of care, ordering additional tests. And I wish her constituent the very best, and I offer her my sympathies in her diagnosis.
Mr. Speaker, the government claims that it wishes to reduce NHS waiting times, but I have written confirmation from this government that they have slashed funding for community diagnostic centres. The consequences of Labour's funding cuts means that brand new facilities such as those at Queen Mary's Sidcup, which I secured £9.6 million of funding from the last Conservative government for, can now only open 2 days per week. Will the Minister urgently review this funding cut so that more patients in Bexley and across the UK can actually get their diagnostics quicker? Thank you.
Thank you for this question. However, I think you might be mistaken. We are opening more CDCs than ever before. I've lost count of the amount of CDCs we've been invited to open, and we're making sure that people have got access to diagnostics in their community, from hospital to community, with the most access that there has been for some years.
Katie Lamb.
Question number 9, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Thanks to the decisions taken by the Chancellor at the budget, we are investing an extra £1.1 billion in general practice, the biggest funding increase in a decade. That funding has allowed us to recruit an extra 2,000 GPs, agree a contract for the first time in 4 years, and introduce online access. I wonder whether the honourable member would welcome that investment, or would she cut it?
Thank you, Mr. Speaker. GP surgeries across the world of Kent, including in Woodchurch and Charing, tell me how much they struggle with rising staff costs. The national insurance increases in last year's budget put huge pressure on them. So can the honourable gentleman please tell us, alongside the investment that he's just mentioned, what discussions he or his health colleagues have had with Treasury colleagues about protecting GP partnerships from further NI burdens in the upcoming budget?
Well, again, Mr. Speaker, I do find it extraordinary that members opposite have the brass neck to raise these kind of questions. Mr. Speaker, they created the mess, and now they're criticising us for not. It's a bit like the arsonists heckling the firefighters, Mr. Speaker. Now, patient satisfaction in general practice has risen from 67% last year to 75% this year, and the proportion of patients reporting difficulty contacting their practice has fallen from 18.7% in July 24 to 10.6% in May 2025. We are just getting started, Mr. Speaker. I didn't hear the honourable lady welcoming the investment.
Sir Gavin Williamson.
Number 10, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. This government is committed to improving survival for blood cancers, including acute myeloid leukemia. We're raising awareness, delivering more research and improving early diagnosis. Blood cancer is the 3rd biggest cancer killer and the 5th most common cancer in the UK. It's why we're committed to developing a national cancer plan with patients at its heart, covering the cancer plan from referral and diagnosis to treatment and ongoing care, which, having consulted with key stakeholders and patient groups, I can confirm will be published now early in the new year.
Sir Gavin.
I thank the Minister for her response. My constituent Ruth Wake, who lives in Brood, was tragically diagnosed with acute myeloid leukemia in January last year. She's gone through chemotherapy and she's gone through a stem cell transplant. And while she's made good progress and she is in remission, sadly the stem cell transplant has failed. Now, under the current rules, if it fails, and it's after 9.5 months it's failed, if it fails under a year, she can't have a second stem cell transplant. Now, I know the pressures that the Minister is under in terms of her time, but my constituent has so little time. Could the Minister look at this case in particular, but also look at the NICE guidelines, because they were last written over 12 years ago, and science and treatment has moved so rapidly, and I wonder if the Minister could look at both of these points.
I thank him for his question and offer my best wishes to his constituent Ruth in her treatment, and I thank him for bringing her story to my attention, and I really do appreciate, perhaps more than most, the urgency of the matter. While I'm unable to comment on individual cases, I do understand that one of my ministerial colleagues is writing to him directly in the very near future on this matter.
Peter Prince.
Thank you, Mr. Speaker. This week, we learned of the incredible results of the Galleria trial, allowing the early identification of many tumours by looking for the DNA circulating in the blood. Indeed, I was myself a volunteer in this trial. So will the Secretary of State join me in recognising the central importance of medical research?
I thank him for his question. Absolutely, I will join him in that. The new progress, particularly around circulating tumour DNA, is really interesting, and we are moving forward with more investment in research so that we can bring forward more such treatments.
Thank you,
Mr. Speaker. Question number 11.
With permission, Mr. Speaker, I'd like to take questions 11 and 13 together. We strengthened the NHS front door with £1.1 billion for general practice, the biggest cash increase in over a decade. We promised to recruit an extra 1,000 GPs in our first year. We recruited 2,000. And patients are now able to request appointments online, a huge step in delivering our manifesto commitment to end the 8 a.m. scramble.
Sure.
Thank you, Mr. Speaker. Great Western Park has added 3,000 homes to Didcot in my Oxfordshire constituency, and Valley Park under construction will add 4,000 more. Yet, the new GP surgery promised in 2008 remains a barren patch of land, and existing facilities can't cope. The Integrated Care Board is supportive, but progress has stalled due to NHS England's involvement. So does the Secretary of State agree with me that integrated care boards should have the authority to direct primary care funding? And will he meet with me to help unblock the new GP surgery my constituents desperately need?
Let me come back to the honourable gentleman after I've found out what's gone wrong in this case, because, as he points out, ICBs are responsible for commissioning, planning, securing and monitoring GP services within their health system throughout delegated responsibility from NHS England, and capital is allocated to ICBs on a basis that takes account of annual population growth. I can understand his frustration and his constituents, so let me find out what's gone wrong and come back to him.
Welsh.
After 14 years of a Conservative government, poor access to GPs is something we have come to know well in certain areas of my constituency of Sherwood Forest. In Hucknall, demand for GPs is overwhelming to the point that one practice has had to close their online appointment system. Promises of a super healthcare system were made by the previous government, but it was never delivered. Meanwhile, local Ashfield independent politicians have disgracefully used it as a political football. Does the Secretary of State agree with me that there has been far too much talk and not enough action, and it is now time that both the Integrated Care Board and Ashfield District Council deliver on this?
Well, it's of no surprise to me that my honourable friend raises yet another example of Conservative broken promises, and of course all the hot air that comes from independents who have all of the luxury of being commentators but none of the responsibility of ever having to deliver anything. I can assure her that I'd be happy to meet with her to look into what's gone wrong here. This has gone on for far too many years, and I can well understand her frustration.
Ian Lavery.
Question number 12, sir.
Thank you, Mr. Speaker. Let me be clear. This government will always protect the NHS and have it as a service free at the point of use for everyone. This government is determined to shift health out of hospitals and into the community as set out in the 10-year plan, and neighbourhood health services will be fundamental to delivering this shift, and it's right that we look at a range of options to provide the best care for people across the country. But let me reassure the honourable members in the House that all proposals are subject to robust value for money assessments to ensure taxpayers get the best possible return on investments in our health services.
Ian Lavery.
Thank you, Mr. Speaker. Might I begin by congratulating the Secretary of State for his actions and trying to repair our cherished NHS following 14 years of Tory destruction. But we must learn from past mistakes, and PFI was a huge, expensive mistake. It was an absolute disaster. £80 billion repaid for an investment of £13 billion. Can the Minister please reassure the House that the lessons of PFI have been well learned and are well and truly in the past and in the dustbin?
First, for his encouragement and congratulations, and let me absolutely reassure him that lessons have been learned and we will ensure value for taxpayers' money on all future proposals.
Pippa Halen.
Thank you, Mr. Speaker. I meet regularly with the GPs in my constituency of South Cambridgeshire, and what they have highlighted to me is They're concerned that they don't yet have clarity or certainty about the role and resources they will have in the rollout from hospital to community and the neighbourhood health areas. And so will the Minister meet with me to be able to provide that for our GPs so that they will be at the table in the rollout of this, our GPs?
Well, I thank her for her question. It is absolutely the role of her local ICB to make sure that they involve all partners and particularly primary care in the exciting rollout of neighbourhood health service, which I think they welcome, and I'm happy to discuss that further with her.
Richard Bergen.
Question number 14, Mr Speaker.
Front bench.
As well as a record investment that we're putting into the NHS, we are making sure that we get a better bang for taxpayers' buck. Under the Conservatives, the NHS, for example, is paying £3 billion to recruitment firms for agency shifts, and we've cut agency spend by a third, and we're abolishing it altogether with the savings reinvested in staff pay and treatment for patients. That's just one example of how our reform agenda is good for patients and for taxpayers.
Richard Bergen.
Thank you, Mr Speaker. I'd like to thank the Minister for her answer. PFI deals did do huge damage to NHS budgets. Despite receiving just £13 billion in assets, NHS trusts were saddled with over £80 billion in PFI debts, most of that still being paid back. We've even seen some hospitals spending more on PFI debts than on medicines. So if it really wants to cut out waste and to avoid a PFI-style disaster 2.0, can the government rule out using private finance for the new network of new NHS clinics, as has been floated?
Minister.
As I answered in response to my honourable colleague, we will absolutely make sure that we learn the lessons of previous failure on behalf of the last government.
Tim Farrell.
Thank you, Mr Speaker. Would the Minister agree that it is completely wasteful to make cancer patients who need to go for chemotherapy, let's say in Carlisle on a Wednesday, who live in Kirkby Stephen, have to travel the day or the day before up to Carlisle again to get their bloods taken? Why? Because the local hospital trust will no longer fund the local GP surgery in Kirkby Stephen or Appleby to take those bloods there. Isn't it wrong that those GP surgeries can no longer provide secondary healthcare blood services within their own settings, within people's own communities?
The honourable gentleman, as he often does, highlights in his own very rural constituency some of the fundamental problems that are broken at the heart of our NHS. That is why we are both reforming it, but also making sure that we move services from hospitals into the community, developing neighbourhood health services, and also looking at the financial flows in the system that lead to these sorts of perverse incentives and funding arrangements that do the damage to his constituents as they do to many others. And rural and coastal communities, that's why we highlighted that in the 10-year plan, and it's those sorts of examples we need to see the end of.
Question Bray.
Number 15, please, Mr Speaker.
Start.
Mr Speaker, we have already made excellent progress turning commitments in the Women's Health Strategy into tangible action, delivering 5.2 million extra appointments, which includes tackling gynaecology waiting lists. We know, though, more needs to be done for women experiencing the menopause, improving awareness and access to treatment. Menopause Mandate have long campaigned for the menopause to be included in the NHS health check, alongside many members in this House. I hope to be able to say more soon, but rest assured we have heard those calls.
Josh Dubry.
Thank you, Mr Speaker, and I very much thank the Minister for that response. Earlier this year, a constituent came to speak to me about shortages of the one HRT drug which was working for her after years of misdiagnoses and ineffective treatments. She told me GPs often recommend alternatives that cause adverse reactions and have very low awareness of menopause, leaving her and many other women paying for private advice and treatment, as well as taking time off work. So could the Minister update the House on what the Department is doing to address HRT shortages and improve training for GPs so millions of women get the support they need?
I thank my honourable friend for highlighting this crucial issue. There are over 70 HRT products, and the majority are in good supply, but we are aware of shortages affecting certain estradiol patches, and we are engaging with suppliers to expedite deliveries wherever we can. Mr Speaker, we've issued guidance to healthcare professionals under the serious shortage protocols and methodology to enable community pharmacists to supply alternatives where appropriate. Furthermore, we're committed to funding research into women's health and have invested approximately £5 million through the NIHR scheme into menopause research, including studies for new treatments to improve outcomes for women experiencing the menopause.
Alison Bennett.
Thank you, Mr Speaker. It's being reported in the press this week that women are being exploited by a menopause gold rush enabled by the tech giants like Instagram. What steps can be taken to make sure that women have access to the very best of information and that misinformation on the internet is got rid of and brought under control?
I thank my honourable friend for highlighting that issue. Mr Speaker, the best way to do this is to beef up NHS digital services, as we're doing to the NHS digital app, so women and all patients can have confidence in the advice that they receive.
Sharon.
16, Mr Speaker.
Thank you, Mr Speaker. I'd like to welcome the Honourable Lady back from parental leave and greatly look forward to working with her again. Virtual wards allow patients to get hospital-level care in the comfort of their own home, speeding up their recovery while freeing up hospital beds for patients who need them most. We're rolling out virtual wards further so they become the norm for managing many conditions at home.
Thank you, Mr Speaker. Earlier this year I visited the Hospital at Home team at the JR, which is an incredible virtual ward. I saw for myself them deliver care to Mavis, who's 91. She was so grateful and emotional for the work they did. We all ended up in tears. But imagine then my disappointment that while I was off, we got an email from the team saying that the funding for this incredible service is no longer there and that they face closure. This is an example of the best of the NHS. We want it rolled out to the rest, but if the funding isn't there for these nascent services to find their footing, then how can we ensure that that can be spread across the whole of Oxfordshire and beyond?
Thank you, Mr Speaker. The Honourable Lady makes a very valid point. This is about the shift from hospital to community, and we've got to drive that forward. In September 2025, there were 12,522 virtual ward beds available. That is an increase compared to 12,497 in September 2024. So slowly but surely we are increasing the number of virtual ward beds and capability, but there is still a long way to go, and I absolutely accept the point that she makes.
Just Athwell.
Question 17, please, Mr Speaker.
Minister.
Thank you very much, Mr Speaker. The Darzi investigation found that NHS resources are too focused on hospitals at the expense of community care. Our reforms will turn the NHS into more of a neighbourhood health service. We have already recruited an extra 2,000 more GPs. We're rolling out 700,000 extra dental appointments, and we have agreed a new contract of investment and reform for community pharmacy. As part of our 10-year plan, we will be rolling out neighbourhood health centres across the country, starting with the places in the greatest need.
Josh Upwell.
Thank you, Mr Speaker, and I thank my honourable friend for his answer and for the brilliant work that the whole team is doing to put the NHS 10-year plan into action. Transforming care into the community will give many more patients quick and easy access to specialist care when they need it. However, for people with Parkinson's, access to Parkinson's nurses who are worth their weight in gold remains deeply unequal. Too often patients are left without nurses and having to travel far to see the specialist nurse. Worse still, few Parkinson's nurses who are available are predominantly funded by Parkinson's UK. Can the Minister set out what steps are being taken to increase equitable access to Parkinson's nurses across the country?
Well, I thank him for that question and congratulate him on the campaigning work that he's doing on this issue. Regular support and advice from a Parkinson's disease nurse specialist is highlighted as a key intervention in NICE's guidelines on Parkinson's disease in adults. The forthcoming 10-year workforce plan will support the 10-year health plan by addressing workforce shortages and skills gaps. This will be crucial for delivering quality and accessible care for those with Parkinson's.
Graham Stewart.
Mr Speaker, ironically, getting care out of hospitals into the community very much depends on a functioning hospital. I met last month with the Group CEO of Hull University Hospital NHS Trust following news that it had been placed into segment 4 of the NHS Acute Trust League table. She acknowledged the urgent need for improvement, expressed clear ambition for change, but she won't be able to deliver the transformation of that important hospital alone. I wonder whether I could meet with the Secretary of State or Ministers to discuss what more can be done to support that hospital on its road to transformation and improvement.
I thank him for that question. I'm not familiar with the details of that case, but if he wouldn't mind writing to me, I'd be very happy to take that issue forward. He is right that there is a mountain to climb, not least because of the mess that was left to us by the previous governments. But we are climbing that mountain step by step. The 10-year plan is a big step in the right direction. It is now all about delivery, and that is what we are doing every day.
Right, we now come to topicals. Gurinder Singh Josam.
Number 1, please, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. Since I last answered questions in this House, the Government has announced £500 million for a fair pay agreement for care workers, NHS Online, the first ever online-only hospital trust, and £80 million for children's hospices. We've announced an independent inquiry into maternity services in Leeds, introduced Jess's rule, implemented online requests for GP appointments, opened the 100th CDC, made the chickenpox vaccine available on the NHS, and published NHS league tables. A lot done, Mr. Speaker, a lot more to do.
Gurinder Singh Josam.
Thank you, Mr. Speaker. So we've promised 2 million more appointments. We've delivered 5 million. 2,000 extra GPs, 6,500 more mental health workers, 7,000 more doctors, 13,000 more nurses and midwives to cancer diagnosis standard met, GP satisfaction up, waiting list down, and a brand new hospital, the Midland Metropolitan University Hospital, opened in my constituency. So does the Minister agree with me that this is the difference the Labour government brings, and we're only just getting started?
Well, why stop there, Mr. Speaker? 15,000 more home adaptations for disabled people through the Disabled Facilities Grant, 135,000 more suspected cancer patients receiving a diagnosis on time, over 200,000 cases off the waiting list, £500 million for the first ever fair pay agreement for care workers, the biggest uplift in carers allowance for a generation. The Tories didn't do it, Reform would undo it. That's the difference a Labour government makes.
Shadow Secretary of State.
Speaker, let me say first of all it's great to be in this new role, and I genuinely want to say that I want to be part of a constructive opposition, but equally do my role in holding this government to account. Now, I note the lack of detail in the Secretary of State's answers on reorganisation. So can I ask the basics again? How many people will be made redundant? What will it cost? And who is paying?
Well, can I welcome him to his place, Mr. Speaker? It's good to hear from the Conservative front bench. I'd almost forgotten they existed. And, Mr. Speaker, they created a complex web of bureaucracy. It's a bit rich to complain we're not abolishing their creation quickly enough. We've had a number of expressions of interest for voluntary redundancy across my department, NHS England and ICBs, and we're working through that as we speak.
Stuart Andrew.
So, Mr. Speaker, again, he can't answer. His answers are too vague. The Secretary of State is very good at making promises, but the facts are he's presiding over a reorganisation that has stalled, creating uncertainty for staff, waiting lists up 50,000 in the last 3 months, hospices in crisis because of national insurance contribution rises, and we have had strikes again despite big pay rises and the threat of more. Mr. Speaker, if he wants the leadership in the future, perhaps he should show leadership in the NHS now and tell us not just the plans, but when he will give the details and how is he going to deliver on his promises to patients.
Mr. Speaker, waiting lists are lower now than when Labour took office, and that is a stark contrast with the record of the government that he served in, where waiting lists increased every single year they were in charge. This is the first year in 15 years that waiting lists have fallen. That is the difference a Labour government makes. We're only just getting started. And as for leadership changes, we all know why they're calling the Leader of the Opposition Kemi Kazi.
Shubha Khan.
Thank you, Mr. Speaker. A Channel 4 Dispatches documentary recently went undercover an ambulance centre in my constituency of Gillingham and Rainham. It showed exhausted staff working under very difficult circumstances, the result of years of Tory neglect and mismanagement of our NHS. Does my right honourable friend agree that after the chaos under the last government, this administration will put staff and patients first? And will the relevant minister come to my constituency to meet with healthcare providers and discuss our local challenges?
I thank her for her question. We know that urgent emergency care response has been low, high standard. We're absolutely committed to supporting Ambulance Trust to continually improve patient experience. And the urgent emergency care plan for 25-26 is backed by nearly £450 worth of funding. I'm very happy to discuss this further with her.
Liberal Democrat spokesperson Helen Morgan.
Very much, Mr. Speaker. Every year we come and discuss the winter crisis in the NHS, but this summer saw record waits at A&E, with more than 74,000 12-hour trolley waits in June and July, something that used to be unheard of. With winter looming and the potential for the A&E perma-crisis to be even worse this year, what package of emergency measures is the Secretary of State putting in place to ensure that patients aren't left to suffer on trolleys or worse in our hospital corridors this winter?
Mr. Speaker, the honourable member is absolutely right to point out that the NHS is already running hot ahead of winter. We brought forward our winter planning for this year to get ahead. We are making sure all NHS trusts and systems have developed plans which have been tested regionally. The flu vaccination programme is well underway. The autumn COVID-19 vaccination began on the 1st of October, and we're driving improvements in urgent and emergency care. This will be a challenging winter. We're not complacent about that, but we're getting the system ready for it.
Marcus Campbell-Sabers.
Thank you, Mr. Speaker. After years watching dentists in Cumbria turn their back on the NHS contract and move those patients that can afford it to private plans, my constituency is now an NHS dental desert. Can the Minister confirm when the Government will publish its response to the consultation on quality and payment reforms and what we can expect to see in it?
Thank you. I thank my honourable friend. The consultation, as he will know, closed on the 19th of August. We're now considering the outcomes of the consultation. We expect to publish a response very shortly. These reforms will better support patients with complex or urgent needs by better incentivising dentists to deliver this care on the NHS.
Morrison.
Thank you, Mr. Speaker. Moya Cole in Hale Green is a shining example of a hospice that does fantastic work in a really tough economic situation. But they really should not be reliant on coffee mornings and jumble sales to fund their most essential services. Liberal Democrat research shows that almost a half of hospices across the UK are planning cuts this year. So will the government commit to properly funding our hospices in the upcoming budget so that they don't need to cut the vital services that they provide?
I thank him for that question, but I didn't hear him welcoming the fact that we provided £100 million, unprecedented amount in capital funding, £26 million a year, 80 million over 3 years for children's hospices. We do actually recognise the fact that hospices benefit from being rooted in their communities with amazing charity and philanthropy supporting them. But of course we know the government needs to do its bit as well, and that is precisely what we were doing. I was very pleased to visit Noah's Ark Hospice in Barnet last week and was so pleased to speak with the chief executive there, who warmly welcomed the stability and certainty that the 3-year allocation has provided.
Shozad Joseph.
Thank you, Mr. Speaker. After a decade of underinvestment in our NHS under the Conservatives, I welcome the progress that has been made on reducing A&E waiting times under this government. But there is no immediate fix. Just last month, a coffee shop at the William Harvey Hospital in Ashford was converted into an emergency ward to treat A&E patients. Will the Secretary of State come to visit the hospital to see the continuing issues with corridor care? And will he update the House on what the government is doing to ensure that William Harvey is able to manage vendor pressure and maintain safe quality care?
I'm grateful to my honourable friend for bringing this to the House's attention. It is completely appalling for coffee shops to be commandeered as spaces for the care of patients. We won't accept this. I am happy to look at the case he mentions, but moreover, we will be publishing figures on corridor care so that we can hold the system to account and the public can hold us to account to improve the situation that we inherited.
Solomon.
Thank you, Mr. Speaker. The Arthur Rank Hospice in Cambridgeshire is losing £829,000 in NHS funding, forcing the closure of 9 beds. That's 40% of their capacity. So does the Secretary of State believe dying patients are better cared for in overstretched hospital wards than specialist hospices? And please don't fob me off with a capital investment. This is about operational costs.
Well, I thank him for that question. As I have pointed out, we are providing unprecedented levels of funding to hospices. There is clearly a challenging fiscal position. I note that the Liberal Democrat manifesto only proposed spending an extra £8 billion for health and care, whereas we have invested £26 billion. So before the Liberal Democrats call for more spending, they should tell us what they would cut.
Richard Quigley.
Thank you, Mr. Speaker. I welcome the changes to the GP booking system, but to get a GP appointment on the Isle of Wight in many cases is still very difficult. A large factor in this is recruiting GPs to the island. Will the Minister assure me that he will investigate all options for improving GP recruitment to coastal, rural and island communities like mine?
I thank him for that question. Through a £160 million investment in the ARS scheme, we have recruited over 2,000 new GPs nationwide. But we do recognise the inequities in funding that can exacerbate regional inequalities in access to services. And that's why I've launched a review of the GP funding formula to ensure funding follows the needs of the population. The National Institute for Health and Care Research has now begun the funding formula review, the Carhill formula, which will conclude in 6 months.
And the best objective.
Thank you, Mr. Speaker. Hinchinbrook Hospital is one of the few hospitals in Cambridgeshire which is yet to have an electronic patient record system. On the HIM scale, its current level of digital maturity is at the lowest end of the scale. Hospitals within the new hospital programme are required to be at level 5 on HIMSS in line with the National Digital Capability Framework. So what financial assistance will be provided to North West Anglia NHS Foundation Trust in order to facilitate an investment case so that the rebuilt Hinchinbrook Hospital has a modern and enterprise-wide electronic patient record system?
Mr. Speaker, the honourable gentleman draws to our attention the appalling state the NHS was left in by the previous government. We are working at pace to introduce EPRs across the system. I'm sure ministers would be happy to look at the case at his local hospital, cleaning up the mess the party opposite left behind.
Adam Thompson.
Thank you, Mr. Speaker. As a migraine sufferer, about once a week I'm afflicted by debilitating symptoms that always include partial blindness and sometimes include numbness in my fingers, nausea, brain fog, sensitivity to light and sound, a pounding headache, or even losing the ability to speak. Heartbreaking for a politician. I'm very lucky, though, that my migraines only generally last half an hour. Others are much, much worse and can last days. What steps is the Minister taking to improve support for migraine sufferers like me?
I thank the honourable member for his question. At a national level, there's a number of initiatives supporting service improvement and better care for patients with migraine. The Getting It Right First Time programme for neurology published a national specialty report making several recommendations in relation to improving recognition and diagnosis of migraine by GPs. Additionally, we've got the Right Care Toolkit setting out key priorities for improving care for patients with migraine, which includes correct identification and diagnosis, and the NHS England established a neurology transformation programme, a multi-year clinically led programme. So lots.
Thank you. I do like a style, but it is far too long for my health.
Speaker, and I refer the House to my register of interest in my role as a serving Norfolk County Councillor. Mr. Speaker, it's now 2 years since the Conservatives in Norfolk oversaw the closure of 2 convalescence facilities, Benjamin Court in Cromer and Grays Fair Court in Cossey, in the member for Norwich South constituency. This was done without public consultation. It's been met with outcry from local residents, and this short-sighted move will only worsen the backlogs at local hospitals and reduce options for my constituents needing extra support. Will the Minister meet me and his honourable friend to discuss how we can ensure that these vital convalescent facilities will not be lost?
Well, I thank him for that, and I don't know the details of that case, but if he would mind writing to me, I can certainly come back to him on it, but it does sound like it's a vital service that needs to be protected.
Jabal MacDonald.
Thank you, Mr. Speaker. In the Secretary of State's list of announcements since the last questions, he failed to mention the appointment of our friend, the member for Glasgow South West, as a minister, particularly looking at life sciences. Without life sciences, without drug trials, we won't see an improvement in the outcome of rare cancers. Can he make a statement on what will be done about rare cancers?
My honourable friend is absolutely right, both to welcome my honourable friend, the Minister, to his place. I'll be honest, he's been a Minister since we came into government, in effect, in any case, so it's very much recognise the work he's been putting in. But on rare cancer specifically, we are determined to do more in this space, working with my honourable friend, with all of the work she's doing, particularly on rare brain cancers, which is much appreciated.
Rebecca Paul.
Thank you, Mr. Speaker. Most young people refer to gender identity services as same-sex attracted, neurodiverse and or traumatised. Looked after children are also overrepresented in this cohort. Is the Secretary of State really comfortable with the children being given puberty blockers, essentially chemically neutering them for the purposes of the Pathways clinical trial?
Mr. Speaker, within days of taking office, I upheld the judgment made by my predecessor. We do need to tread carefully and sensitively in this space. We do need to take an evidence-based approach to trans healthcare in our country, and that's the approach this government will take.
Sarah Smith.
Mr. Speaker, as you may be aware, Reform-led County Council have opened a consultation into the future of care homes across Lancashire, including the proposal to close Woodlands Care Home in my constituency of Hyndburn. Will the Minister agree with me and join me in urging Lancashire County Council not to take forward these proposals, to protect those local services that are so well valued, keep care close to the community and with the amazing staff that support our residents in Woodlands Care Home?
I thank her for that question. I absolutely agree. It's been very interesting to see that all the rhetoric of many of these reform councils has come crashing down with the reality of the situation in which we find ourselves. Adult social care plays an absolutely vital role in the shift from hospital to community, and I'm very happy to meet with her to discuss that matter further.
Damien Hines.
Thank you, Mr. Speaker. Alton and Petersfield hospitals give excellent step-up, step-down and end-of-life care. The Trust is introducing more home-based care, and that is a good thing, but also proposing to close a ward in one of the community hospitals. Will the Minister ensure that there remain sufficient beds, sufficient capacity in our local community hospitals for those patients that need them?
Mr. Speaker, in September, Hampshire Hospitals NHS Foundation Trust reported a step-down immediate care capacity as the primary reason for discharge. For Portsmouth Hospitals, the NHS Trust was 13% lower than the average. Now, as much as immediate care is important, we know from evidence that getting home is better, and that's why we're putting record amounts of money into the Better Care Fund to make that possible.
Clive Efford.
Mr. Speaker, can I draw to the front bench's attention the prostate cancer research report published last week? It busts the myth that a screening programme for prostate cancer would actually cost the NHS too much money. It would focus on those people most at risk, i.e. black men over the age of 45 and people like me who have a history in their family. Would he join me in commending this report to the National Screening Committee?
I'm grateful to my honourable friend for his question and the inequalities he draws our attention to too. We will look at this report carefully. I am awaiting the recommendation of the National Screening Committee. We'll look carefully at that and I'll report to the House on our decision following that.
Savile Roberts.
The security supply of medical radioisotopes is critical for the treatment of many conditions and also for diagnosis. Is this a responsibility of his department? And does he support Welsh Government's Project Arthur scheme at the nuclear licence site in Trawsfynydd in my constituency?
I thank her for that question. Security supply is obviously of importance to the entire government. My portfolio includes pharmacy, which is a very important part of that. I'd be very happy to meet with her to discuss the matter that she raises further.
Thank you, Mr. Speaker. In my constituency of Stafford, Eccleshall and the Villages, I recently ran a survey which had a whopping 99% response rate in support of an urgent treatment centre in my constituency. Would the Minister agree to meet with me to discuss urgent treatment provision in my constituency?
The Honourable Lady does an excellent job in her constituency. I meet with her regularly on the issues in her constituency. Very happy to discuss provision of urgent care centres with her.
James Wilde.
Thank you, Mr. Speaker. Greater transparency in NHS data should be used to drive improvement. So what assessment has the Health Secretary made of the impact on the Queen Elizabeth Hospital in King's Lynn of being forced to make savings of £18 million this year on the need to reduce waiting times for A&E and cancer, as identified in the league table that he published?
Mr. Speaker, we're putting £26 billion more into the NHS this year, investment that was opposed by the party opposite.
Mr. Speaker, as the chair of the APPG for dyslexia, something I've campaigned on for many years, I remain alarmed at the high number of dyslexic people that still need to use mental health services. Will the Minister meet with me to discuss how we can better serve dyslexic people in Broxtowe and across the UK and consider measures to prevent more dyslexic people from needing mental health services?
Mr. Speaker, I'm very grateful to my honourable friend for sharing her personal experiences, and I've been delighted to meet her at a time of her.
Jim Ramsey.
Thank you, Mr. Speaker. I welcome the approval of the planned new dental school at the University of East Anglia. So, what arrangements and incentives will the Minister put in place to keep dental graduates in the poorest served areas, such as my constituency of Waveney Valley?
Thank him for that question. He will have seen that in the 10-year plan we've committed to tie-ins. So once the current cohort is through its studies, new cohorts will be required to be tied in to doing NHS dentistry for a period of time after graduation. I am sure that he welcomes that very important measure.
Eleanor Dolan.
Mr. Speaker, Jules Fielder is a young woman from Hastings who has tragically been diagnosed with terminal lung cancer after doctors repeatedly missed the early symptoms. Jules is now channeling her personal tragedy into action and campaigning to raise awareness of early symptoms and wants shops like Boots and Superdrug to use their shelf space to raise awareness. Will the Minister join me in paying tribute to Jules' amazing campaigning work?
I thank her for raising this issue, and I offer my sympathy to Jules and her family and best wishes. And of course, I commend her work to raise awareness. It's really important. And her experience is also one of the reasons why we're rolling out targeted lung screening and starting to use ANI to detect discrepancies in screening as well.
To Ben Spencer.
Thank you, Mr. Speaker. Children in Runnymede and Weybridge are waiting on average 2 years to get a diagnosis of autism or ADHD from Surrey and Borders. The Trust is deviating from national guidance on neurodevelopmental pathways, and waiting times are even greater if children need medication. Does the Secretary of State share my concerns, and will he investigate the Trust and make sure children and families get the support they need?
Mr. Speaker, I'm very grateful to my honourable friend who has some considerable amount of expertise in this field for bringing this to light. He will appreciate he was also part of the last government which let waiting lists run out of control, and he will also appreciate, although I'm unable to directly interfere in ICB decisions, I'm very happy to write to them to ask for an update and update him when they reply back to me.
Jane Kirkham.
Thank you, Mr. Speaker. My constituent's baby, Bran Tunnicliffe, sadly died last year. They shared their experience with me and described the wait for a coroner's report as a lottery, depending on which hospital pathologist and coroner is involved. I know there's a shortage of pathologists in the UK. Would the Secretary of State meet with me to discuss their experience?
Mr. Speaker, I'm so sorry to hear that, having experienced such unimaginable heartbreak, the family then have to go through that additional trauma. I'd be delighted to meet with my honourable friend and look at what we can do together with our friends at the Ministry of Justice to improve the experience for families in that awful situation.
Final question, Gregory Campbell.
Mr. Speaker, some progress has been made in the early diagnosis of prostate cancer. Will the Secretary of State undertake to ensure that when further progress is made, which we all hope to see, it will be shared quickly and efficiently with the devolved regions?
The honourable gentleman that commitment. I work very well with my counterparts across Wales, Scotland and Northern Ireland, regardless of party affiliations, and I think that's a very sensible suggestion.
Point of order, Dr Caroline Johnson.
Mr. Speaker, I'm concerned the health team may have inadvertently misled the House. In July, the JCVI recommended that RSV vaccines were so effective they should be extended to all those over 80 and in adult care homes. The Secretary of State reassured this House in July this was accepted as a recommendation and will be in place for this winter. But when I asked today, the Secretary of State said from a sedentary position he delivered on this promise, and the Minister then confirmed this. But government and NHS guidelines still show availability for this vaccine has not been extended. How can I ensure that the record is correct?
And continue the debate, but you certainly put it on the record. Point of order, Stuart.
Thank you, Mr. Speaker. I had meant to say at the beginning of my questions I wanted to pay tribute to our former colleague Oliver Colville, who sadly passed away last night. He served for Plymouth, Sutton and Davenport between 2010 and 17. He was named by Conservative Home as one of the minority of Conservative MPs not to have voted against the government, something as a previous whip I thought was exceptional. He really was a true gentleman whose eccentricities always endeared him to many, and I'm sure the whole House's thoughts are with his family.
Yeah. Just to say, we all remember Oliver Colville very fondly. He really was a good MP, nice kind of guy to meet. I knew Oliver way before he came in this House. No, we're all saddened to hear it. Secretary of State.
Mr. Speaker, on behalf of the government and this side of the House, can I associate myself fully with the remarks of the Shadow Secretary of State? He was a decent man, a wonderful public servant. We will all share in that, and I'm sure my honourable friends on this side of the House will absolutely follow his example when it comes to following the whip.
Point of order, Mr. Stewart.
Thank you, Mr. Speaker. Again, just to Oliver Colville was loved on all sides of this House, and as we are going to have the 175th anniversary dinner of Lords and Commons cricket, it's worth remembering one of the most famous wickets ever taken, which was in India on live television, watched by tens of millions, when Oliver Colville bowled and took that wicket, and I've never seen a triumph like it. He'll be much missed, and he was always loved and respected when he was in the House.
Yeah. His brother was the famous Sky cricket commentator, but we're not going to continue that. We're now going to go to the urgent question. We'll let the front bench change over. Welcome to the urgent question. Shadow Home Secretary Chris Philp.
Thank you, Mr. Speaker, for the urgent question. To ask the Home Secretary to make a statement on the recent criticism of the statutory inquiry into the rape gang scandal.
Minister.
Thank you, Mr. Speaker. As stated in my previous statement to the House on the 2nd of September and in my letter to the Home Affairs Select Committee yesterday, the Government remains resolute in delivering Baroness Casey's recommendations following her national audit into group-based child sexual exploitation and abuse. These crimes committed by grooming gangs are among the most horrific imaginable, and her report exposed over a decade of institutional inaction, and we are determined to ensure such failures are never repeated. Central to our response is a statutory national inquiry under the Inquiries Act 2005, which will oversee local investigations with full powers to compel evidence. It will be time limited to 3 years to ensure that victims and survivors receive answers swiftly. The inquiry will examine safeguarding systems, accountability and intersections with ethnicity, race and culture, identifying failures and good practice. The inquiry will work alongside the National Police Operation Beaconport. The appointment of the chair is at a critical stage, and we hope to confirm the conclusion of this soon. Victims and survivors have been at the heart of this process with trauma-informed opportunities to share their views. We've engaged with them on the chair appointment and the terms of reference, which will be shaped by the chair in consultation in public, again, with stakeholders. As widely reported in the media, victims and survivors are meeting prospective chairs this week. Today, in fact. This process, contrary to the reporting, was not managed by the Home Office, but by an independent child exploitation charity, the NWG. We are gathering views to ensure their perspective remains central. We must avoid delays, as was seen in the independent inquiry into child sexual abuse, and are progressing as swiftly as thoroughness allows. Misinformation undermines this process. Allegations of intentional delay, lack of interest or widening of the inquiry's scope and dilution are false. The inquiry will remain laser-focused on grooming gangs, as Baroness Casey recommended.
Thank you, Mr. Speaker. This scandal arose because young, mainly white girls were systematically gang-raped, and this was covered up by those in authority because the perpetrators were mainly of Pakistani origin. So it's all the more shocking that when calls for a national inquiry became public in January, the Prime Minister smeared campaigners as jumping on a far-right bandwagon. Comments like that are a disgrace and are what led to this scandal being covered up in the first place. Months later, just 2 days before facing a vote in Parliament, the government finally agreed to the inquiry. But it's clear the government never wanted this inquiry, they were forced into it. Perhaps that is why, months later, the government has said nothing substantive publicly and their inquiry is descending into chaos. What we have heard publicly is that victims and survivors on the liaison panel have no confidence in the government and no confidence in the inquiry. In the last 24 hours alone, 2 have resigned. Fiona Goddard resigned from the panel saying this: "The secretive conduct and conditions imposed on survivors by the government has led to a toxic and fearful environment with a high risk of people being silenced all over again." And hours later, Elianne Reynolds also resigned, saying the remit of the inquiry had, and I quote, been widened to downplay the racial and religious motivations behind our abuse. The Minister shakes her head. That is what Elianne Reynolds says. Fiona also raised the issue of Saba Kaiser, who has been acting as a liaison officer on behalf of NWG. Just 2 years ago, Ms. Kaiser described calling out the fact the majority of perpetrators were of Pakistani heritage as, and I quote, destructive, distracting and irresponsible. Given those frankly appalling views and the complaints about them by survivors, will the Minister ensure Ms. Kaiser plays no further role? Victims and survivors have also questioned the suitability of former police officers or social workers to chair the inquiry. They do not believe people from the professions which failed them so badly are suitable. So will the Minister accept this feedback and appoint a judge to lead the inquiry? Will the Minister confirm the scope of this inquiry will not be diluted, as both Fiona and Eliane say is now happening, and confirm it will focus on the cover-up of the rape gang scandal because the majority of perpetrators were of Pakistani origin? Finally, Fiona said this yesterday: I won't be gagged and controlled by the government while they turn this inquiry into a cover-up. So will the Minister apologise to Fiona and to Eliane?
What I would say to the honourable gentleman is that he didn't listen to my remarks at all, because suggesting that the government has silenced anybody is that the government has not handled this process. It has been handled by a grooming gang charity, of which he cites and names a victim of crime. And look, what I will say to the honourable gentleman, which he would know if he had done anywhere near the level of work that I have done, is that not all victims and survivors are of the same opinion. They are not one homogenous group of people who all think the same thing, who all want the same exposure, who all want their identities known. And so what I would say is that I have spoken to Fiona Goddard many times, and I will continue that relationship with her, should that be what she wishes. And every single survivor who has been engaged with, of which there have been many, will have different feelings on this subject. With regard to him requiring a judge, Baroness Casey said to this House in the Home Affairs Select Committee she did not want a traditional judicial-led inquiry. She was explicit. And if anyone in this House can find me an institution that didn't fail these girls over the years, including our courts, who took the children away from the grooming gang victims, who criminalised some of them, there is no institution in our country that hasn't failed. We will continue. Today I will meet with many of the victims and get their feedback, and I will continue to progress. With that in mind, I will engage with all the victims regardless of their opinions, and I will listen to those that have been put in the media, that are put in panels. I will always listen, and I will speak to all of them.
Jim Backman.
Thank you, Mr. Speaker. Oldham has stepped forward to take forward a local inquiry, and it's been waiting to understand what the move to the national inquiry means for its own work. The same is true of victims and survivors whose bravery and strength in the most difficult circumstances has been truly remarkable. Can I ask the Minister what arrangements are being put in place to ensure that there is a clear front door offering support that is fully independent of councils and police forces? And while local deep dives are clearly important and they are essential, can we have an assurance that if the evidence takes the investigation beyond boundaries for council and police forces, that those will be followed to the fullest?
Minister.
I will not be chairing the inquiry, so I can only say to him that the terms of reference that will be set, and as I have said, I'm not sure that this is usual, they will be consulted on in public because of the issue of, I have to say, bad faith and a concern about transparency. They will be consulted on. The remit of the inquiry will be decided by the chair, living within those terms of reference. But I have, having been part of various different inquiries or watched from a distance, that no stone will be left unturned, and whoever chairs this inquiry will feel empowered to do what they think is best.
Liberal Democrat spokesperson Max Wilkinson.
Thank you, Mr. Speaker. It has been 4 months and longer since the Home Office announced the National Statutory Inquiry into group-based child sexual exploitation. I know ministers will have wanted quicker progress. We on these benches do too. But we still have no chair, no terms of reference, and most importantly, no justice for the victims who have already waited years. And now 2 members of the Victims and Survivors Liaison Panel have stepped down after raising concerns about shortlisted chairs. They seem to have lost confidence in the process before it has begun. The Home Office must listen to and act on the concerns of victims. I know the Minister will agree. It must get this inquiry off the ground. That is the only way to ensure it proceeds with integrity and with the trust of those it is meant to serve. Mr. Speaker, now is the time to prioritise justice and prevention over political point scoring, and I know the Minister will agree with me on that too, because this is an extremely sensitive matter, particularly for the victims. So will the Minister now commit to publishing that terms of reference, along with full details of the inquiry's budget, staffing and a timeline by the end of this month? And if not to that deadline, when will that be published?
I thank the honourable gentleman for both his tone and approach, and what I would say to him is that as per the Inquiries Act, the terms of reference has to be set and it has to be consulted with the chair. The chair is being decided, and the reason it is, I have to say, it isn't taking any longer than the COVID inquiry. It isn't taking any longer than the infected blood inquiry. I think that was 7 months. Each took 7 months from the announcement to the appointment of the chair. And I have to say, I don't remember huge amounts of criticism or bellyaching, because we wanted to get those things right. And actually getting this right means dealing with lots of different stakeholders of victims with different views. And so the process has to follow that the terms of reference has to go through the chair. And so we have already done with victims groups, we have already done some of that work on the terms of reference, but we cannot publish those, which we will do publicly, like I say, until there is a chair appointed. And I will not rush it, because I am going to take note of all of the feedback that I receive.
Thank you, Mr. Speaker. Today, the government announced that it will take parental responsibility away where a child is born of rape. This will protect grooming victims. Children in this country will no longer be the only proceed of crime that criminals can have lifelong access to. Does the Minister agree with me that survivors have been failed for too long by a government that didn't prioritise giving them justice? A party led by a leader of the opposition that did not mention grooming when she had the power to do something about it. Instead, survivors have had to wait for victims and activists to be on these benches and the most fierce of advocates to be at the dispatch box.
I thank the honourable lady, and I think she mischaracterises me as the fiercest of advocates, because she, as a grooming victim herself with a child born of rape, is the fiercest, bravest. I could cry. I feel so proud that what this government did was seek to get her elected. And I have been campaigning for the thing that she has fought for with grooming gang victims for nearly a decade. I met with ministers of the then government and nothing was done. It is because the exact thing that the member for Bolsover has campaigned for was asked for repeatedly and nothing was done. It is because of her and this government that today I am incredibly proud of her and to say that will change.
Rob Moore.
Thank you, Mr. Speaker. I have a copy here of the government's response to the developments last night, addressed to the Home Affairs Select Committee, and I have to say that I find this response completely unacceptable. Is the government seriously implying that Fiona and Ellie, who have been disbelieved and called liars by the British state their entire lives, are spreading misinformation about a process that they have been directly involved in? Because that would be a deeply damaging thing for any government to imply. And worse, Mr. Speaker, there is a line in this letter about the government's proposed inquiry in Oldham, which says the government, and I quote, have been in discussions with Oldham Council about the right approach for Oldham. But how can that possibly be right? How can the Home Office discuss the right approach with the very local authorities that they are being investigated? It would be like the Post Office inquiry sitting down with the Post Office to negotiate how they should be investigated. So can the Minister explain how the government will be restoring trust right now in this process, given the contents of this letter that the Minister sent to the Home Affairs Select Committee last night?
Minister. Can I just be completely clear? I'm suggesting that I will listen completely and utterly to the feedback from the victims that were and still are on. That they are not spreading misinformation at all, but his interpretation is a brilliant case in point, because I will be completely honest, the conversation with Oldham is, do we not think it might be better for them just to take part in a statutory inquiry? It is absolutely nothing to do with the idea that Oldham is telling me what to do. And the more people from that side, he can hold up his paper and have a smug face all he likes. But the fact of the matter is that there is absolutely no council in this country who will tell this inquiry where it can and cannot go. I have said that 1,000,000 times from this dispatch box, and yet the same thing gets peddled again and again.
Thank you, Mr. Speaker. And I know the Minister won't want to comment on individual candidates to chair the National Grooming Inquiry. Can I just put on record that Jim Gamble is a highly regarded police officer with a long experience of dealing with this, and when his leadership of the Child Exploitation and Online Protection Centre proved what a fearlessly independent figure he was, with a real track record of tracking down sick paedophiles online and offline. But does she agree that the chair of this inquiry has to be someone who can earn the trust of those who have been let down far too long by those in positions of authority? And can she confirm, as I hope she will, that the inquiry will not shy away from issues of race or class and will follow the evidence wherever it leads?
Minister. First and foremost, I can absolutely confirm that. And not only that, the Home Office has asked, which was, I have to say, not done before, for police forces across the country to collect data on ethnicity. So absolutely that will not be the case. And with regard, I won't be drawn into, because it's not up to me. Although what I will say about the gentleman that the honourable member has mentioned is that he did resign because he previously, from a previous role working in this, because he thought the then government wasn't invested enough in child sexual exploitation.
Thank you, Mr. Speaker. Mr. Speaker, the victims of these crimes were vulnerable children who were ignored and who were gaslit and who were dismissed. Two women have now resigned, two victims have now resigned because of this process and their lack of failure in the process. And yet what I hear from the Minister appears to me to be an aggressive and defensive tone. Does she regret the fact? Is she going to listen? Well, is she going, remember these people are watching, is she going to listen to the victims, and does she regret that these two individuals have resigned from the process?
Minister. I absolutely regret that they have resigned from the process that, funnily enough, actually, in the particular incidents of one of the people, I have had no involvement in it. I do not know who are on the panels of victims. It is entirely independently managed by a grooming gang charity. One of the only interventions was to ensure that some of the voices who I thought deserved to be heard, that their names went forward to make sure that they were included. So I have done that on a number of occasions. Of course, I will listen to them. I'm actually meant to be with them in actually right now, I'm meant to be in with those panels of victims, hearing their response right now. And I will absolutely, as I have said, I will take the feedback, both publicly and should they want to speak to me, as I have approached them, of anyone. But of course, I'm always sad when victims feel that they can't take part in a process. Of course I am. What I have to say is there are many different victims and they have many different views. And just because of the ones that we hear publicly, I want to make it clear that there are many different victims and we have to make sure that all their voices are heard equally, whether they are part of the process or not.
Peter Dow.
Thank you, Mr. Speaker. The Minister has reiterated time and time again that victims must be at the centre of an inquiry. Given that, can she tell us what she intends to do to ensure that that aim is fully implemented?
Minister.
Look, from the inquiry, again, while the inquiry is ongoing, that will be a matter for the Chair. However, from the inquiries that I have been involved in that were successful and were victim-centric, there always has to be a system for supporting the victims, both taking part in the inquiry, but also just supporting them with the trauma that might be brought up. And usually those two things are separate. But once again, I am not going to be the chair of this committee. But undoubtedly making sure that victims are protected throughout the process, and should they want to go out and speak publicly, both negatively and positively, about that process, I would absolutely welcome that. People should never be stopped from speaking, but we have to make sure that there is available for support regardless of how you wish to gain it.
Carl Lockhart.
Thank you, Mr. Deputy Speaker. There should be nothing more precious in the eyes of this Parliament than the protection of children, and particularly those who suffered at the hands of these barbaric individuals. Many of us are parents, aunts, uncles, grandparents, and this cuts very deep. But I know the Minister cares and is a caring person, but today we need decisive action. And given how one of the victims has walked away from the inquiry, two of the victims have walked away from the inquiry, can the Minister state clearly how she will ensure that a fully independent inquiry can take place and that it prominently includes victims?
Minister.
I mean, all I can say is that the victims I am meant to be getting feedback from right now, that the reason I can't stand in front of you, I could have just gone, like, in the air and picked out some random judge. I could have done that. We could have done that. But the reason this process, and the reason I can't even say when I will definitely be able to say when the chair is because I am listening to victims' feedback. But again, I have to stress that that process isn't easy. There are difficult dynamics within different within groups of people. There are difficult things being dealt with by the people who we have asked to engage. And so undoubtedly, that isn't uncomplex, and anyone who has ever worked with groups of people who have been wronged and shamed and treated badly would know that the idea that there is a straight line, a simple answer, to tell them that there would be a simple answer would for me to stand here and lie to them, and I am not willing to do that.
Thank you, Mr. Speaker, and can I thank the Minister for her continued work. All victims and survivors who for too long have not had their voice heard, we need to make sure that is happening, and I'm sure the Minister is making sure that is happening. Can the Minister confirm what resources are available to ensure that survivors are properly supported through the process? And in terms of system delays, we know there are still issues with court delays, we know there are still issues in terms of making sure we go after all the perpetrators. So is she able to give a bit of an update on that and on the J inquiry recommendations? Thank you.
Minister.
I mean, absolutely. I think next week I will be chairing an interministerial group of cross-government to push through the other recommendations. Baroness Casey actually made 12 recommendations. People rarely speak about any of the others. But she did actually make 12, and this wasn't her most pressing one. Operation Beaconport, the policing one, was actually the one she put at primacy. And as I said in my previous statement on the 2nd of September, the 216 cases that move forward, that work is absolutely ongoing and runs alongside it. And actually, that's where justice will be served in our courts, if only they hadn't been horrendously degraded, that meant that rape victims are waked for years and years.
Sir Gavin Williams.
Thank Thank you, Mr. Speaker. I think the thing we all very much agree on is that the voices of survivors have to be at very much the heart of this, and it's worrying and concerning when two of those survivors don't feel as if the process is properly looking after them and making sure their voice is heard. Would the Minister commit to speaking to both Fiona Goddard and Eliane Reynolds to try and encourage them and reassure them that this is a process that really will listen to their voices?
Absolutely, that opportunity has already been presented to them. That I would be more than happy. I know one of them. I don't know another one. That opportunity is always available. One of them has my phone number. So the idea that I don't listen and have not been making myself available. I have tried to keep the process fiercely independent of government intervention so that process can happen and victims can feel safe in that. But of course I feel sad that this is how it has ended. And actually, I hope this isn't how it has ended, and I will commit to working to make sure that this isn't the end, and my door is always open to them.
Sheila Mims.
Thank you, Mr. Speaker. In 2012, a Bangladeshi national was sentenced in my Carlisle constituency for attempting to recruit 4 girls, aged 12 to 16, into prostitution. In his summing up, the judge described how the man's conduct had corroded the foundations of decency and respect by which all right-thinking people live their lives, whatever their ethnic or religious background. Will the Minister take the opportunity to again reassure all right-thinking people that this inquiry will look at everything to find answers, including the role of ethnicity?
Minister.
I will say it again and again. It will not shy away from findings where they are present, and anybody who has actually done the work in this space would know that is going to be found, as her case in her constituency highlights. There is absolutely no sense that ethnicity will be buried away. And I have to say, every single time when there is some apparently needless delay, even though, as I've said, it took 7 months to put in place chairs for both the COVID inquiry and the blood inquiry, and nobody moaned about that. The way that gets used, the misinformation I'm talking about, is the idea that that's because we want to cover something up. It will not cover things up. We are taking time to make sure that can never happen.
Bob Blackman.
Thank you, Mr. Speaker. I know the Honourable Lady has been an outspoken champion for the victims and will continue to be so. But she must be concerned that 2 members of the panel have withdrawn, and we understand one of the candidates to chair the inquiry has withdrawn as well. And clearly there is a concern across the House about the fact that institutions that have failed the victims, such as the police, social services, councils, etc., and courts, are all in a position whereby they failed. And therefore, whoever chairs this panel, this inquiry, is going to have full rigour on services that they may have been involved in. And so, therefore, there's a matter of confidence. And can she update the House then on how that inquiry will report back to this House and what scrutiny this House will have over the actions of the inquiry and the terms of reference?
Minister.
I'd like to thank the Honourable gentleman, because he is in somewhat of a unique category of always asking a question that is genuinely, it leads me to further questions that I think are pertinent. How the inquiry will report into here whilst it is ongoing is not necessarily something that usually happens, but if there, look, I will take that away, and if there is an appetite, but all I can say is there is no institution in the country, this one here, that doesn't have skeletons. Do I think all politicians wouldn't be robust in this? No, I don't. I think some would, and I can guarantee that I can point at people, the honourable gentleman included, who would show absolute rigour even against his own. And but there isn't a single, like with ICSA, we had a judge was leading ICSA. They lost the confidence of the victims. 3 people lost the confidence of the victims. It took 2 years. So there isn't an institution that didn't fail these girls. That's the whole point. There is no clean skin, but there are people, brilliant people, people who whistle blew, people who tried in every one of those institutions. And so that is essentially where we are left with this. But I promise rigour, the same way that when I saw what things happening in here, I certainly was rigorous in Smith.
Thank you, Mr. Speaker. I commend the Minister for her formidable personal leadership on this, and I'm so proud to sit on these benches alongside other formidable campaigners too. The Minister has reiterated that the inquiry must be trauma-informed, and I know from speaking to victims in my constituency of Aylesbury just how vital this is, that we're cognisant both of the initial trauma that they've experienced, but also of the re-traumatising effects of going through the process of seeking justice for themselves and for others. So can the Minister set out more about how she'll ensure that this trauma-informed approach is woven through the ongoing inquiry?
Minister.
I absolutely, as the inquiry sets up, as previous inquiries with very, very vulnerable groups of people, ICSA, that there will have to be things put in place to ensure that people can freely give their evidence, and that will have to be done in a trauma-informed way. And as was number 12 of Baroness Casey's recommendations, was that it would be, that what was needed for all of the recommendations would be fully funded by the government, and this government has absolutely committed to that. I very much expect that when the chair is in place, those conversations about exactly how that will look will begin. And the only thing I do actually control, I suppose, in any of this is that this government will pay for it.
Lee Anderson.
Thank you, Mr. Speaker. The cover-up continues. We have a Prime Minister who never wanted a national inquiry. We have a Minister who never wanted a national inquiry, and we have the Labour backbenchers who never wanted a national inquiry. So does the Minister agree with me that the victims of these horrific crimes will never get the justice they deserve as long as we have a Labour government in charge?
Minister.
It's quite impressive that you would stand up and say that after a grooming victim stood up and spoke on these benches, but, I've learnt to expect it. When the honourable gentleman stands up and talks about cover-up, I understand that or maybe he's doing it for clicks, I don't know, but I understand that he thinks he's doing, God's work in fighting this. The level of bad faith, the idea that it's easy to find a chair or easy to find people who want to step forward and take part in this process when it is mired in, I have to say, political point scoring like he just did. I have to say, I think that he should really question his own morality.
Sarah Russell.
Thank you, Mr. Speaker. Ellie Reynolds has said that financial dependency has made people stay silent when they should speak, and also alleged that people on the panel were isolated by discouraging contact with each other. I fully understand that the Minister has been extremely clear that this is a fully independent process and hasn't had government involvement. How does she propose to handle, though, the very complex relationship here between how Ellie Reynolds has spoken very clearly about concerns and ensuring that the process does retain the faith of everyone involved?
I mean, as I've said, what I would very much hope to do is hear those concerns directly from Ellie herself and see what can be done. What I also know, because I only know the victims that I know and have worked with before, when they have been on the panel, they speak to me about it like that because I have personal relations with them. What I can say is there are differing views about the levels of confidentiality. The confidentiality is not to silence people from speaking about their own experiences. It is because there are people in those rooms who have never shown their face, who are also victims. And for an agency, having run one myself, trying to manage that I can see why perhaps somebody might say, like, you know, you shouldn't like try and seek out the people outside of the meeting, because others might have said, I don't want people to, but they're not going to say that in public. So all of those things I can imagine. I'm trying to get across the idea of how complex these situations are, but I am more than happy to listen to Ellie and see what has gone wrong in the process for her and seek to make it better. I'm absolutely happy to do that.
Mike Wood.
Thank you, Mr. Speaker. And we've heard what the Minister said about diverse views amongst victims, but is she concerned that some survivors of these terrible crimes have described the process in the terms that they have as a toxic, fearful environment, warning that there is a high risk of people feeling silenced all over again? And what is she going to do to reverse this failure?
Minister?
I mean, I refer you to my previous answer. I'm going to speak to them, which I have said now a number of times, and look into the process, not a process that I have personally been part of. Like I say, I can only speak to the victims who just I happen to have known before, and if they tell me they are on it, not the other way around, I can't ask who is on it. That it is confidential by its very nature. But look, of course I'm going to listen to that feedback, and like I've said, I will speak to those victims involved.
Catherine Atkins.
Thank you, Mr. Speaker. Victims must be at the heart of the grooming gangs inquiry. Does the Minister agree that getting the right chair is absolutely key to ensuring that that happens? And does she agree that we have to avoid the scenes that we saw under the last government, which appointed 3 chairs who then withdrew from the independent inquiry into child sexual abuse, an inquiry that took 2 years to start?
Minister.
The Honourable Lady, who I know has some experience of inquiries from her previous life, is exactly right. I look at and people don't remember it now, but there were victims going out in the press complaining about what was going on with ICSA. It went through numerous chairs. There is already much worse faith that exists, both rightly and wrongly in this instance. For me to allow that to happen in this instance would just make people shout, cover up. And so we are trying to do everything that is possible to make sure that those mistakes made by the previous government are not made again.
Finish, Matty.
The credibility of the National Inquiry rests on the voices, experiences and needs of victims and survivors placed at its very centre. Can the Minister show victims in Wales how this inquiry will be guided by their best interests when survivors have such grave concerns that they feel they must resign from liaison of the panel?
I mean, look, I think that to go back to the previous answer, that the chair of the inquiry will set the tone for the inquiry. And that is why getting the right chair and making sure that the system is available for victims who want to take part in the inquiry that will care for them and look after them all have to be in place. But and that, you know, is what we are working to achieve.
Joseph.
Thank you, Mr. Speaker, and I thank the Minister for her responses, and I absolutely agree with her that it's crucial to get this right. So can the Minister be absolutely clear that the inquiry will not be watered down, particularly the focus on grooming gangs and ethnicity, including models of grooming where groomers focused on the ethnicity of victims, whether that be young white girls or even Sikh girls?
Minister.
Absolutely, and I absolutely pay tribute actually to the community response in his local area to recent incidences of very, very hideous sexual violence and put on record my love to the families and victims involved. But absolutely, this is a grooming gangs inquiry, and it will follow what Baroness Casey stated. As I stated in my statement, it will be 3 years long, it will not show away, and it will be a grooming gangs inquiry.
Thank you, Mr. Speaker. I acknowledge the Honourable Lady's commitment to get to justice on this, and I recognise the frustration that she expresses as someone who was responsible for the Infected Blood Compensation Scheme, meeting a diverse group of 40 different charities and representative bodies that didn't agree with one another. However, I would gently and respectfully say to her that we do face a credibility gap on this issue. And I would urge her to examine how she can get ahead with the communications in order that she can continue to demonstrate her commitment to get to justice. Because, frankly, we as members of Parliament have to come to this place when things get into the media and public concerns are expressed. And I understand her frustration, but getting that communications right and maintaining that pathway to delivery of justice is critical.
Minister.
I don't disagree with the honourable gentleman, and if I believed that either most of what I see reported on anything in this space is largely inaccurate and often comes with an agenda, if you will, more so I think than in the case of Blood, but I absolutely recognise and take my hat off to the job that he would have had to have done. But I absolutely recognise that, and there is a balance between wanting to give a complete and utter running commentary on a very complicated thing and making sure that people feel like something is going on, because nature abhors a vacuum and so does misinformation.
Chris Murray.
Thank you, Mr. Speaker. The Minister has heard me many times implore her to move as speedily as possible to address the challenges of victims of this awful crime. But can I on this occasion implore her to take the right time to find the right judge? This is not a normal public appointment. This is someone who has to command the confidence of this House, of the public, and most importantly of survivors, that they will leave no stone unturned, investigate everything, whether it be ethnic, class or institutional, and will make her life harder if they have to. Will she take the time to find the right judge and not repeat what we saw with the child sexual abuse inquiry several years ago?
I absolutely will, and I think he gives me the opportunity to say that no matter who is picked, there will be people who are unhappy with it. Like most politics that we deal with, let's just call a spade and stop pretending that there is a perfect situation. There is the best situation we can have. And funnily enough, in the conversations that I have had with some of the prospective chairs, the main thing I want them to take away is that I want them to feel that if they have to slag me off all day long, and you know what, I'd say the same to the victims, then that is exactly what they should do.
Becca Paul.
Thank you, Mr. Speaker. Can I thank the Minister today? She obviously feels very deeply about this, and I think we all agree that anyone that was involved in these awful, horrific crimes must be held to account, and anyone who turned a blind eye, we must also shine a light on that and make sure that doesn't happen again. Can the Minister provide commitments that the inquiry will not be politicised, particularly after multiple local authorities have attempted to block investigations? I think this is a really important question, because we do see this happening. Everyone needs to be investigated on this. It doesn't matter what party you are. This is too important.
Absolutely, 100%. And look, it would far be it from me to sit here and speculate about where I'd like it to go. But let me tell you, if I had my way and I was the chair of this inquiry, it wouldn't. You would not be surprised. I think that look. Where I live is one of the places that I have grave concerns about, because that is where I worked. That it wouldn't stop me wanting to look there if I was the chair, because it has a Labour council. I couldn't, excuse my unparliamentary language, give a toss about...
Can I just say, I'm sorry for the Minister that she felt she had to push it. She's doing an excellent job. She doesn't need to push it. She's better than that. I'll listen to you. No, I'll listen to you.
Thank you, Mr. Speaker, and I thank the Minister both for her statement and also for the passion and rigour that she brings to her role, even if sometimes she might say things that she has to apologise for. We greatly appreciate her dedication to the role.
It may help. One of us is going to have to sit down. Actually, I granted an urgent question, so that's the helpful why we're here. Thank you.
Thank you, Mr. Speaker. Every survivor's experience of abuse is unique. Does the Minister agree with me that by taking the time to find the right chair, they will then be able to make sure that every story will be fully told?
I mean, I really hope so, but I'm not going to do what other people seem to want to do in this circumstance and pretend that there is a guarantee that I have some sort of magic weapon. But that is the process that I am undertaking, is that we get the very, very best chair that is supported and alongside the victims who have been taking part in that process.
Thank you, Mr. Speaker. Getting this right is both important and extremely difficult. I have two questions for the Minister. If, when she meets Fiona and Eliane, she finds that they're right and there is something wrong, can she tell the House what powers does she have to intervene on that? And my second question is, will the Minister provide assurances that the inquiry will not be staffed, again she might be able to comment on her powers and powers of influence, will not be staffed by individuals who previously dismissed the concerns of survivors and campaigners as racist slurs?
Minister.
So to the first question, I have every power to intervene in the process of how that panel, but the decision that I made was that it should be independent of me and it should be independent of my offices, and that it would be better handled by experts in this field. So, but you know, when I speak to them, of course I can raise those and I can make decisions about how it goes forward. I very much hope that we will be drawing to a conclusion, and that actually my involvement in it soon will be much lesser. To his other question, victims and survivors of this crime all have different political opinions, all have different views on the substantive. They have different views about whether it should be called grooming, whether it should be called grouped. They have different views on all of these things. I will not stand here and say that I would eliminate any victim or survivor based on their political... But any victim or survivor working on this, and I will continue to say that as it is, because of their views, because many of them don't like me very much. Imagine if I just didn't let the people who didn't like me very much not have their voice heard. Well, frankly, I'd be guilty of a cover-up.
Thank
you, Mr. Speaker. The Minister has made it clear that women and girls were failed by every institution. And it is a positive step forward that the failure is now acknowledged by government, and that acknowledgement is leading to action after years of inaction. But in Scotland, we have absolutely no acknowledgement and absolutely no action. So I want to ask the Minister what advice she would give me and others across Scotland who are becoming increasingly angry that the Scottish Government is doing all it can, not just to block an investigation, but to block any kind of independent scrutiny or case review of organised child exploitation.
I think that the Honourable Lady, first thing I'd say is that the inquiry, whilst is in England and Wales, one of the victims that we have been hearing about today, Ellie, lives very much in the borderland of our two great countries. And there is absolutely no doubt in my mind that some of the things that may get found in the inquiry will have findings across the border. Unfortunately, the trafficking of young girls does not follow lines on a map as easily as we might think it does when we administer it. But look, what I would say is that you have to continue to work with survivors groups up in Scotland to push for what exactly it is that they want to see in Scotland.
Thank you, Mr. Speaker. I thank the Minister very much for her answers, and I know that the Minister's heart is in this to get justice, and I don't think there's any doubt about that. However, the news that these victims who have already been denigrated and treated as voiceless and worthless during their initial abuse have been made to feel this way once again in this committee. It is difficult to hear, and the Minister will understand that it's also difficult for us to accept that this is taking place on government watch. So will the Minister not agree that the inquiry is not getting this right, and instruct immediate action to be taken to give these young women their voice back and ensure that justice is served and safeguards are in place to prevent those from taking place on British soil ever again.
Minister.
I absolutely share his upset and frustration on the matter, and I think that he knows that when I say that I will do whatever I can to ensure that these problems are sorted out where they can be, that is what we will seek to do, and we'll continue to try and do that. But absolutely, what we have to do with this inquiry isn't just look at what went wrong and hold people to account. We have to make sure it cannot happen again.
Sam Carley.
Thank you, Mr. Speaker. And can I say to members opposite that their relentless politicisation of this is no doubt making it much harder to find a chair because it will be putting candidates off. Mr. Speaker, as this inquiry gets underway, we must keep up progress on implementing the recommendations of the J Inquiry, ICSA. I raised concerns at report stage of the Crime and Policing Bill that the government's proposals to implement mandatory reporting of child sexual abuse don't go quite as far as ICSA wanted, and those concerns were raised again in the other place last week by Baroness Gray-Thompson. So will the Minister ask her colleague Lord Hanson to meet me and Baroness Gray-Thompson to discuss how we can remedy that in a way that works for everyone and protects children?
The simple answer is yes, I will ask that. To his first point, absolutely right, is that what we should all seek to be doing throughout this is trying to grease the wheels so that we can have the best inquiry possible. We should all be seeking to do that whilst holding people to account with as much scrutiny as is needed. But I will absolutely do that, and obviously I have met with him a number of times, and getting this right on mandatory reporting is vitally important, and much like in the survivor group, there are different views on either side.
Chris Webb, final question.
Thank you, Mr. Speaker. Blackpool continues to live with the scars of Charlene Dowes and Paige Chivers, two young girls in Blackpool that never came home but were subject to grooming. Will the Minister confirm to my constituents in Blackpool South that the grooming gang inquiry will be thorough and comprehensive, committed to a full and transparent investigation, ensuring every avenue is examined to uncover the truth?
Minister.
I absolutely will, and funnily enough this morning I spoke to one of his constituents who has been a previous grooming gang victim to assure her of similar things, because I have to say quite a lot of this causes quite a lot of nervousness around and the need to manage lots and lots of different people's emotions, but I absolutely make that commitment to him as I made to one of his constituents this morning, and I make it to this full house.
Okay.
A complete point of order, Jeremy Corbyn.
Point of order, Mr. Speaker. Could I invite you to examine Hansard column 652 from yesterday during the exchange about Maccabi Tel Aviv supporters travelling to Aston Villa? In reply to my question, the Secretary of State said she agreed with me about the safety of everyone walking the streets, but went on to say perhaps he might make that point to the people he now associates with on his left and right, because that is not what we've heard from them in the last few weeks. I find the suggestion in that my colleagues have done anything other than say everyone should be able to walk the streets safely in our society, and they were concerned about the danger from football supporters acting in a hooliganistic way at an Aston Villa game. I think the Secretary of State should correct what she said.
Jeremy, come on. Hang on, you've certainly put it on the record, you've certainly ensured that the correction and your view is there. What it doesn't do is continue as a debate, and you know that as a long-standing member of this House who's got great respect, and I will leave it at that, because you certainly ensured that we're all aware and the correction takes place. Mims Davis.
Thank you, Mr. Speaker. Point of order, and following the points made by my right honourable friend from Salisbury, despite the Minister's best efforts on where she is or isn't involved in terms of this response to the urgent question that you've granted today, I am genuinely more confused, and I think many constituents will be on this. May I ask on this point of order that the honourable lady, despite her saying that she's not looking to create a running commentary on this, would she undertake to update the House clearly to assist on these matters so that we can avoid urgent questions such as this?
Minister.
I'm not sure what she's confused about. A victims panel was set up to look at both terms of reference and to look at the appointment of a chair. There's a variety of different groups of people. Some of them have done both. Some have taken part in just one or the other, usually depending on time and logistics, as you might imagine. These are people. And that has been managed by an organisation called NWG. I have not taken part in those sessions other than the feedback on chairs, because that was said that was what. So the feedback on the chairs' appointments comes to me. I don't have to go to that, but I go and sit and listen. And usually that's the first time I know who has been on the panel when they have been interviewing chairs. So the process is entirely managed. I happen, because of my years of experience, to know quite a lot of the people. And so I do speak to some of the people who are on the panel because they I have personal relations with them and have supported them over the years.
Thank you for that. Okay, that completes the urgent question. Thank you. Well done.
Which brings us to the 10-minute rule motion. Bradley Thomas.
Thank you, Madam Deputy Speaker. I beg to move that leave be given to bring in a bill to require a company that meets a specified criteria to report any cyber extortion or ransomware attack on the company to the government within a specified time frame after the attack, to make provision about the content of such reports, including a requirement to provide information about any payments made and for connected purposes. This is a timely and pressing matter. Illegal activity across the nation is on the rise, and cyber attacks are no exception. The National Cyber Security Centre has reported a 50% increase in British cyber incidents deemed highly significant over the past year. Furthermore, of the 429 incidents the NCSC was called upon to assist with, at least half were considered of national importance. Amongst the significant threats identified in the NCSC's 2025 annual review are hostile states such as China, linked to a coordinated campaign involving 3 Chinese-based companies targeting foreign governments and critical networks, and Iran, which the NCSC assessed as a highly likely threat to UK entities. UK IT leaders are understandably alarmed. Research from Armis has revealed that 74% of UK IT leaders cite China and 71% cite Russia as their top cybersecurity concerns. And if that's not enough, recent espionage trials have thrown a harsh spotlight on the scale and intent of state-sponsored cyber operations. The threat is undeniable. We must act with urgency to safeguard UK-based companies and critical infrastructure before these escalating menaces begin to seriously disrupt the functioning of our nation. Under current legislation, cyber attacks need only to be reported in limited circumstances. Namely, operations handling personal data must report cyber attacks that pose a likely risk to individual rights. Essential service operators and relevant digital service providers must disclose incidents with substantial service impact, and a few regulated bodies such as the Financial Conduct Authority and the Solicitors Regulation Authority follow their own cyber incident reporting requirements. Notably, there is no requirement for companies to disclose when a ransomware payment has been made, despite the significant financial burden that such payments can impose. Cohesity's 2024 Global Cyber Resilience Report found that 59% of companies targeted by ransomware chose to pay, with an average cost of £870,000, with some reaching as high as £20 million. The reality is clear. Cybercrime, particularly extortion and ransomware, has outpaced existing legislation. It has allowed dangerous gaps to emerge in our intelligence gathering, gaps that criminals are likely to exploit, and has weakened the defences of our national critical infrastructure against these escalating threats. The Cyber Extortion and Ransomware Reporting Bill seeks to close these gaps and reinforce the UK's resilience against cybercrime. Following Australia's successful implementation so far of a mandatory ransomware payment reporting scheme, it's imperative that the UK follows suit. This bill would mandate any British company registered under the Companies Act 2006 with an annual turnover above £25 million or is responsible for critical national infrastructure to inform the government within 72 hours of becoming a victim to a cyber extortion or ransomware attack, with a further report being required if any payment is made by the company or a third party on their behalf within 72 hours of the transaction taking place. We've all witnessed the shocking headlines. Major British companies under siege from cyber attacks resulting in severe disruption and millions in lost revenue. From M&S to the Co-op, Harrods to JLR, these attacks have been crippling. And yet the government currently has no legal right to know whether a ransom payment was made to restore their systems. But what if that payment was made to a terrorist organisation? What if it was sent to a hostile state? It is not the fault of the companies who, under immense pressure and with limited options, choose to pay to regain control of their operations. The fault lies in the gaps within our legislation, gaps that allow ransom payments to go unreported, potentially fueling even greater threats against our nation. The proposed threshold of an annual turnover exceeding £25 million, or those responsible for critical national infrastructure, has been carefully considered. It captures approximately 78% of medium-sized businesses and all large corporations, whilst avoiding an overwhelming influx of reports that a lower threshold would trigger due to a high number of SMEs in the UK. National critical infrastructure comprises all 13 sectors defined by the government. That includes chemicals, civil nuclear, communications, defence, emergency services, energy, finance, food, government, health, space, transport and water. This criteria captures the vast majority of companies whose compromise through attack or ransom payment could pose a serious risk to the UK. It also reflects the volume of reports our resources can realistically manage, whilst establishing a clear, accessible threshold so companies aren't forced to navigate complex policy during the stress of an active attack. Another imperative component of this approach is the inclusion of all payment types, whether monetary, intellectual property, and exchanges of gifts or services or other forms of benefits. This broader scope will enable law enforcement to trace criminal networks, identify patterns, and disrupt the flow of illicit funds. It will help to inform better resource allocation, as well as holding the potential to foster collaboration across sectors that would result in faster alerts and stronger resilience. I understand that many companies may have reservations regarding the requirement to report incidents and ransom payments. It could leave them vulnerable to reputational damage from potential leaks and damage their business further. This proposal is pro-business, and that is why robust legal protections would be established to ensure that any reports made to the government remain strictly confidential with no right of publication unless deemed to be in the national interest. This will give companies the assurance they need to report without fear and the support they deserve to help their recovery. What happens if a company fails to report within 72 hours of an extortion attack or neglects to submit a report following a ransom payment? Quite simply, they would face a civil monetary penalty. Mandated reporting is essential to our national security and collective well-being. Non-compliance must be actively discouraged. It's in the company's interest, the public interest, and it is in the government's interests. The absence of mandatory reporting, especially for ransom payments, leaves a dangerous blind spot in our national security. When companies report these payments, our security agencies gain vital intelligence. Intelligence that helps us understand who is being targeted, how attacks are evolving, and where our vulnerabilities lie before they're exploited. Espionage today is not confined to spies and stolen documents. It's digital, it is silent, and it is relentless. The grey zone exists. Cyber extortion and ransomware attacks are fast becoming the preferred weapon of hostile actors seeking to destabilise our institutions and exploit our vulnerabilities. Their attacks are becoming progressively more complex, often leaving companies with no viable alternative but to make ransom payments. From individual hackers to organised criminal gangs to state-backed attacks from overseas, we can't afford to fall behind in the race of technological defences and expose ourselves to increasingly sophisticated cyber extortion attacks. Whilst I acknowledge that the government referenced the introduction of a cybersecurity bill in the King's Speech, it's deeply concerning that despite the urgency of the threat, the bill has yet to even be brought before Parliament. Cyber criminals are not slowing down. Their methods are not becoming simpler. On the contrary, attacks are growing in complexity, scale and impact. And although I recognise that sound policy requires time to develop, we cannot afford to proceed at our current glacial pace. Delay only deepens our vulnerability, particularly in light of recent events. We must act decisively and without hesitation to safeguard British businesses and protect our national security. The choice before us is stark. Either we allow ourselves to become increasingly exposed as criminals outpace our outdated legislation and other nations fortify their defences, or we rise to meet the moment with urgency, resolve and the protections our country demands. It is time for us to send an important message. We will not allow cyber criminals to continue operating in the shadows unchecked and unchallenged.
The question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Tom Tuggendart, Alison Griffiths, Dr Neil Shastri-Hurst, Joy Morrissey, Sakib Bharti, John Glenn, Greg Smith, Ben Obsi-Jekti, Lincoln Jopp, Sir John Hayes, Jim Shannon and myself, Madam Deputy Speaker.
Bradley Thomas.
Cyber Extortion and Ransomware Reporting Bill.
Second reading what day?
Friday, 29th of May 2026.
Friday, 29th of May 2026. The clerk will now proceed to read the orders of the day.
Sentencing Bill Committee.
Order. Order.
Sentencing Bill.
Can I remind members that in committee, members should not address the chair as Deputy Speaker, but please use our names when addressing the chair. Madam Chair, Chair and Madam Chairman are also acceptable. We begin with amendment number 46 to clause 1, with which it will be convenient to consider all amendments, clauses stand part, new clauses, schedules and the new schedule as on the selection and grouping paper. Before I call the Right Honourable Member for Tatton to move her Amendment 46, I should advise the House that once that amendment has been disposed of at the end of the debate, I am provisionally minded to call the following amendments and new clauses for separate decision. Amendment 24, in the name of the Honourable Member for Bexhill and Battle. New clause 6, in the name of the Honourable Member for Huntingdon. New clause 9, in the name of the Honourable Member for Bexhill and Battle. And new clause 30, in the name of the Honourable Member for Chichester. Esther McVeigh.
I beg to move Amendment 46. Madam Chair, I oppose the whole idea of forcing courts to give suspended sentences when they should be sending offenders to prison. We all know that it is hard to get sent to prison in the first place, and judges and magistrates do not send people to prison lightly. In fact, they don't send people to prison enough, as far as I can see. So being forced to send even less people to prison is extremely worrying. And this is what my amendments seek to try and address today. Now, Madam Chair, we can't make a silk purse out of a sow's ear, so it won't be possible to transform this disastrous bill into a good one. All we can seek to do today is to make it less bad. But be under no illusion, this bill takes a sledgehammer to our justice system and will dismantle law and order in this country. And to call this bill a sentencing bill makes a mockery of us all. It should be called the Avoid a Sentence Bill. For this bill is a slap in the face to victims and will embolden offenders who will quite literally be laughing all their way to their next crime. First, Madam Chair, I will make a bit of progress and then I will. First, Madam Chair, I want to put on the record my support for amendments in the name of my honourable friend, the member for Bexhill and Battle, and the honourable member for Clacton, particularly in relation to the abolition of the Sentencing Council and the deportation of foreign criminals. But because of time constraints, I will speak to the amendments tabled in my name only. I'll give way to the Honourable Lady.
Thank you. I thank the right honourable member for giving way. I just want to go back to a point where she suggested this bill is going to bring law and order into question. As a former prison officer myself, I would say that it was a previous government running our prison system to a boiling point that nearly brought law and order crashing down, including having less than 100 bed spaces available last summer, and maybe a little bit of reflection from the party opposite on what they did to His Majesty's prison service whilst they were in office and whilst I was serving would be poignant on this debate today.
I'd like to thank the Honourable Lady for making that point. I'd also like to point out that actually under the last governments, 3 prisons were built, which was HMP Five Wells, HMP Fossway, HMP Millsike. That was adding an extra 8,500 places, and 3 further prisons will also be built. I will indeed.
The active management of the prison service was, of course, hard work, managing it at those levels of occupation. But that hard work was absolutely necessary and much preferable to simply taking a view that we won't have all those criminals in prison at all. The reality is that what we're doing now is much worse.
I agree with the Honourable Member. This is a disgrace of a bill that won't be sending people to prison, and at the same time it will be letting people out of prison. So I will start with amendments 46, 47, 51 and 52, and would change the length of sentence that qualify for these get-out-of-jail-free suspended sentences to ones of less than 12 months, as opposed to 12 months or more, and only before any credit is given for a guilty plea. Sentences of 12 months or more are obviously given for more serious offences than those less than 12 months. Also, as the bill stands, I understand those who will be sentenced to 18-month sentence would be appropriate, and they could hit the jackpot after, because they will take into account the credit of a guilty plea. That will reduce it to 12 months, and therefore they will qualify under this bill for a suspended sentence. People don't get sentences of these lengths for nothing, and so I hope the government will reflect on these amendments to reduce the maximum sentence that has to be suspended. Now, I gave a quick scan of my local papers for who had got an 18-month sentence, which could now become a suspended sentence. And this was for a lady who caused unnecessary suffering of an animal and was in possession of a samurai sword. It was also for a lady for glassing a pregnant friend in the face. And another one was for coercion and controlling behaviour, and they also got a 5-year restraining order. These could all get suspended sentences now. The bill currently says that the presumption in favour of a suspended sentence need not apply if the court is of the opinion that making the order would put a particular individual at significant risk of physical or psychological harm. My amendments 48 and 53 would extend this to include the public, who are, after all, a collection of individuals, and they too deserve protecting. If the court is concerned that the offender is likely to be a danger to the public, then they should absolutely have the right to ensure they go to prison and not go back into the community on a suspended sentence. Amendments 49 and 54 change the risk level by removing the word significant. I would have thought that any identifiable risk should be covered, as these are people's lives we are talking about protecting here, and we should not be playing a game of Russian roulette with them. Ironically, it seems the Sentencing Council saw things a similar way, as they have previously listed as that is not as a reason to have a suspended sentence. Amendment 50 and 55 would mean that anyone not being sent to prison as a result of this change, who otherwise would have been, would have to be given the maximum length of suspended sentence. In other words, the sentence would hang over them for the longest possible time. They should not be given a shorter period, as could be the case with normal suspended prison sentences. New Clause 42 would ensure that those given these suspended sentences are electronically tagged throughout. Using a tag to monitor their location out of prison could make them think twice about reoffending, and if they then were to reoffend, it could make detection and resentencing much easier. The next amendments I want to talk to concern the type of offending that we are allowing to be included in this ridiculous prison avoidance legislation. There are so many offences that will be covered by this exemption, it's hard to know where to start. This has got to be addressed, and I sincerely hope the government will accept my amendments here. I think most people will believe that we've completely lost the plot if we allow some offences to be ones where prison sentences cannot generally be handed down. New Clause 44 would exclude knife crime from being one of them. I can't actually believe that I'm having to table an amendment to prevent a whole load of criminals who carry knives from being kept out of prison. Yet this is what the bill will do. Does no one anywhere actually think through what is being proposed and how it will affect public safety? It would be completely disgraceful for this government to ever claim to be serious about tackling knife crime when, under this legislation, the presumption will be that many people carrying a knife will no longer be sent to prison. How is this going to help prevent the loss of life on our streets? I will indeed.
Honourable Lady, for making this point, because many of us will have examples in our own constituencies of families that have been tragically affected by knife crime. Some of those go on to do some amazing work to try and help educate young people, but at the same time, it's important that where a sentence has been given, it is actually carried out, and that almost deterrent is in place, because yet again we're seeing from the benches opposite, from the Labour government, the removal of deterrence.
Right honourable friend is absolutely right. The removal of a deterrent is what this bill is doing. And I will also mention repeat knife offenders are supposed to get a mandatory minimum 6-month immediate custodial sentence, not to be given an effective guarantee that they are likely to evade prison because their sentence is 12 months or less. Why would anyone think twice about carrying a knife if they know they are going to not see the inside of a cell and the courts will be powerless to send them to prison? I will indeed give way.
I thank the honourable member for giving way. I truly understand and appreciate the effects of knife crime, and we have all had cases in our own constituency demonstrating the devastation caused by knife crime. But does the honourable member agree that we should actually also be focusing on rehabilitation and preventing people from carrying knives? Education is so important on this issue, and this is the way forward for us to ensure that knife crime is decreased for the future.
Rehabilitation is indeed key, but so is prison. Prison is essential for people who have committed crimes. That's why prisons are about. It's about removing a danger from society. And rehabilitation is, of course, key. I will indeed.
I'm extremely grateful for my honourable friend. We hear a lot of messages opposite about rehabilitation. We hear a lot about recidivism. The most likely spur for recidivism is letting people out who will continue to do harm. We will be told by the government they're being out on licence. I wonder if my right honourable friend might invite the Minister to predict how many people we record while they're on licence, because the Justice Secretary has already described that number as too high. Will it rise as a result of this measure?
Mr McVeigh.
My right honourable friend makes his point clear there. I know the Minister was listening there, so I think they will be able to, I hope they'll be able to answer that question for your good self. Surely people cannot seriously think it would be acceptable, for example, that those who commit offences involving firearms or ammunition to be eligible, nor those who even commit some terror-related offences. As things stand, they would also be covered by this bill. My new clauses, 51 and 53, would amend that ludicrous position. New clause 52 would exclude burglars. We do not see nearly enough of them in courts because of the lack of detection of their crimes. So the ones we do see in court should be routinely guaranteed, right, to go to prison, not be spared jail, and that will be what happens here. New clauses 43 and 45 would mean that those assaulting our dedicated police officers or emergency workers would not be eligible for, or would be eligible for, suspended sentences, which is an absolute disgrace. And Madam Chair, I just want to mention here, when the government was in opposition, they made such a noise about emergency workers, police officers, prison officers, how they should be sent to prison. For example, the MP for Ronderen, Ogmore, brought his private member's bill in 2017-2018 about the assault on emergency workers and how the maximum prison sentence for a worker should be moved from 6 months to 1 year. And the reason is it is part of the problem that all too often people simply do not feel at the end of their process there will be justice. This is what the government said on opposition. The Right Honourable Member for Sheffield Heeley said, the attitude which sadly exists across the criminal justice system, that punching or kicking someone is somehow to be accepted. We will never accept that people should be assaulted while they are doing the job, and we will do everything in our power to protect them. And the MP for Bedford said in a debate, we must put legislation in place to guarantee a tough line will be taken on anyone who assaults an emergency worker. Well, that's what the government said in opposition. They are doing the exact opposite now. Those people will now be let out on a suspended sentence. I cannot believe that the opposite benches will not join with me and vote for Amendment 43. I would like to test the will and the temperature of the House on this. Somebody had given way on it. As the bill currently stands, the presumption against immediate custody will also apply to those committing a whole host of other nasty, violent and sexual crimes, all of whom will be eligible for these get-out-of-jail-free suspended sentences if they are going to be sentenced for 12 months or less for their crimes. New Clause 50 would mean that sentences with a mandatory minimum sentence would not be included and help to alleviate the damage in some cases. New Clause 54 would prevent offences that are capable of being appealed as being unduly lenient from the mandatory suspension prison sentence. The unduly lenient sentence scheme covers offences such as sexual offence, stalking, putting someone in fear of violence or serious harm or distress, controlling or coercive behaviour in an immediate, intimate or family relationship, and inflicting grievous bodily harm, unlawful wounding, amongst others. It would be a nonsense for crimes included amongst the most serious under the scheme to have been dealt with by way of a suspended sentence and not immediate custody. How would this work on appeal? Would all sentences be overturned as being unduly lenient, or would the new law trump all those schemes? My amendment would inject a bit of common sense and would avoid all of this. My other amendments mainly concern the past of the offender in question. It is bad enough for a first-time offender committing a serious crime to be avoiding prison, but serial offenders being rewarded under this new law for reoffending is outrageous. New Clause 46 would mean that any offender who had committed 3 or more offences in the preceding 12 months would not be eligible for a mandatory suspended sentence, and New Clause 47 would stop them from qualifying if they had committed 10 or more offences previously. Multiple offences, and yet the government is letting people off with a suspended sentence. I will indeed give way.
We have a situation where 80% of offenders are re-offenders. That is because of the 14 years of mess that this government is having to clear up. And we're in a situation where what the real travesty of justice is when there are no prison cells available for people who are convicted. The last government failed to build the prison places that are needed. This government will ensure that they exist because they will always need to be. And it is like we have got the opposite benches who've left the taps turning and then whine about the flood that they let happen.
I'm glad the Honourable Lady stood up and raised this point. I remember when I was brought back into Cabinet Office, I heard these calls from the left-leaning civil service in the Department of Justice, who were also saying, let's let people out of prison. It is running too hot. We cannot. And thankfully, I stood firm, said no, so did the Conservative government. Yeah. Not like this government, who has let thousands of people out of prison and is destined to do so again. I'm afraid this is ideological. It is because the people on the opposite benches don't think people should be going to prison, or not more people should be going to prison, but they should be in the community. It is ideological. It is certainly not logical, and it certainly does not support law and order in this country. It is an absolute slap in the face for victims. I will not. So I will carry on here. New clause 48 and 49 would mean offenders would not be eligible if they had previously been given a suspended sentence or an immediate prison sentence for the same offence. It would be ludicrous if an offender committed a burglary, say now, and went to prison for it, and then after this new legislation comes into force, they were convicted of another burglary, but instead of being given a longer prison sentence than the last one, as most people would think was fair, they would be given a suspended sentence because the court would have no other choice in many circumstances. New clause 55 would exclude criminals who had previously breached suspended sentences on 3 or more occasions from qualifying for a suspended sentence. Now, it could be argued that if they'd have breached a suspended sentence once, then they should not qualify, and I completely agree. However, I will make it that it's a 3 strikes and the person is out. They cannot keep committing offences and just getting suspended sentences. Another strong case for at least 3 strikes and the offender is out, is covered by New Clause 61, where an offender has convicted of committing the same crime 3 or more times. So somebody who's committed the same crime 3 or more times would now only get a suspended sentence. These people should be getting appropriate prison sentences, not being guaranteed no prison sentence at all. New clause 59 further mentions poor compliance with court orders being a reason not to suspend a sentence. If the court can see that the criminal has not complied in the past with non-custodial alternatives and therefore is highly likely to breach the suspended sentence, then they should have the option to impose immediate custody on the offender. This is in fact already in the current and past sentencing guidelines when it comes to considering an optional suspended sentence, never mind a mandatory one, which we'll have if this bill is brought into being. New clause 60 would mean that offenders before the court to be sentenced for 3 or more offences at once should not be able to expect the presumption in favour of a suspended sentence to apply. And all of these examples I am given are coming from judges and lawyers. These are not possibilities, not things I've dreamt up. These are happening now. These people should be going to prison. They would be going to prison. But under the government, we're letting everybody out. Yeah. That's why I say we are dismantling law and order in this country if this bill goes through. Now, there is nothing to stop magistrates and judges handing out suspended sentences if they think they are appropriate. But these amendments would not force them to hand them out when they are clearly not appropriate, which is what the government is doing. They are tying the hand of the justice system. The government have already made amendments to their earlier legislation after presumably realising they had missed something. And I hope on reflection today they will follow suit, hearing some of the disasters that are about to befall the country because of this legislation. For example, my new clause 56 is very similar to amendments the governments have tabled in their Gov 2 and Gov 4 to exclude those who are, for example, already subject to a suspended sentence. They've seen one loophole, but it's like a colander of loopholes. Hopefully they'll see a few more. However, they have not ensured that the bill does not apply to those on licence. My new clause 57 says that those who have been released early from prison are on licence should not be eligible for this presumption in favour of a suspended prison sentence for offending again, when really they should be locked up. I will indeed.
I'm very conscious that what the Honourable Lady's putting forward is very logical and sensible and seems to be a way of going forward. But I'm also very conscious, Madam Chair, of the fact that young people in particular, they can do something wrong in life and then they can return back to the area that they came from. They're subject to peer pressure, they're subject to all the things that happens in that community. And sometimes I think that they probably need help outside of the legal system. Is that something that the Right Honourable Lady is considering when putting forward the legislation to ensure that people do get a second chance, but do get the help where they need in the constituency or the locations where they live?
We all believe in second chances, and that is where the rehabilitation comes into force. What we're dealing with here are possible multiple offences, continuous offences, and already those people before the court have already had some kind of community sentence, some kind of tagging system, and they are still repeating their crime. So what we don't want to do is allow them now to think there absolutely is no deterrent. They can commit crimes as often as they want because it will only be a tiny slap on the wrist. People need to understand their actions are unacceptable. There is a victim, there is a price to pay for that. And some people will understand that and then will go on the straight and narrow and have a good life after that, but not with what is being delivered today. It says, commit a crime and you won't be doing any time. Wrong, 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 and a wrong message to send out. Now, this really should not need saying, but it seems it does. How on earth can it be right that someone has been released early from prison will then get a second get out of jail card free? And this will also happen under this ludicrous legislation. New clause 41 means that the presumption against prison should not apply to foreign nationals. If people come to this country and commit crimes serious enough to warrant a custodial sentence, then they should not be left wandering around our streets freely as a result of this bill. Foreign offenders should be deported, as protecting the public is one of the main duties of a government. I'll have to repeat that several times to the opposition. Or the government, I should say, to the government, who don't seem to understand that is a major part of their duty. And in the meantime, they should be locked up. Whilst we have to put up with our own British criminals, I do not see why we should be lenient to those who have come to this country and committed offences. I do not think the public will agree with the government's bill either. I would urge all my colleagues in the House of Commons to think long and hard about the likely consequences of this bill and the needless victims of crime it will inevitably create. Anyone who allows this bill to go through without amendments to protect the public will effectively have blood on their hands as soon as someone is injured or killed by a criminal who should have been in prison but wasn't, as a direct result of this terrible new legislation. Finally, if the bill does go ahead, then my new clause 62 would insert a sunset clause so that in 2 years' time, when we see what a catastrophic mess this bill and this government has created, we will all be glad that there can be an end in sight to it. I will indeed.
The sunset clause is it relieves the monstrous contradiction that we've had from the other side. Yeah. They have presented this legislation as an emergency measure because the prisons are too full, and yet they boast at the same time about their great expansive prison building programme. Clearly the two are at odds with one another. Who is going to be put in these prisons if this legislation persists? That's why her sunset clause is so important.
My right honourable friend is exactly right, which is why I pointed out this is all about ideology. This isn't logic. And obviously, I mentioned the extra number of prisons started in 2020 when the previous government gave £4 billion to expand prison capacity. 3 of those prisons have been built. There was a delay, obviously slow. We were locked down for 2 years in lockdown. That's why some are now coming on board. And there will be another 3 prisons built. If people are really, really serious about cleaning up our streets, about getting crime down, about supporting victims, they would not be voting for this bill, and prison places are either here or on their way. I'm afraid, just like the prison minister has said, he only thinks 2/3 of prisoners should be in prison. Yeah, he did. No, sorry, 1/3. Only 1/3 should be in prison. 2/3 should be out on the street. And that's why I say it is ideology over logic and over the public.
The question is that Amendment 46 be made. Andy Slaughter.
Thank you, Madam Chair. As I did at the start of my speech at second reading of the bill, I put on record the continuing crisis in our prisons. The prison population currently stands at 87,427, with usable operational capacity being 89,286. Prison population projections estimate that the population could rise to over 100,000 by March 2029. That is both an indictment of the previous government and gives the lie to their mantra that this bill is soft on crime. We will have record numbers of people in prison. So this bill is a necessity. What we must do is make a virtue of that necessity. I welcome the principles of this bill and the reforms suggested in it. They are essential both to reduce the prison population and improve the way the justice system does punishment, rehabilitation and public safety. The measures in the bill, which derive from David Gauke's independent sentencing review, include varying suspended sentences and short custodial sentences, adopting the earned progression model for release, and changes to recall and licence. All have their risks. The purpose of the amendments I and other members of the Justice Committee have tabled, to which I now turn, is to reduce those risks and make practical improvements to the bill. I've also tabled 2 new clauses relating to IPP prisoners who are, wrongly in my view, not currently considered by the bill. The first amendment I've tabled is amendment number 29 to clause 3. This relates to income reduction orders, or IROs, which will act as financial penalties for offenders to forfeit a percentage of their disposable income as a form of punishment and reparation. My amendment changes the definition of monthly income for the purposes of an IRO so that any amount of money that's required to be paid or deducted from an offender's monthly income because of other enactments, such as child support, maintenance payments, or under an attachment of earnings order, is not counted. This will ensure that IROs do not impact upon an offender's ability to pay outstanding debts or, in the case of child support maintenance, to meet their obligations to support their children and family members in the community. My second set of amendments relate to clause 6 of the bill, which introduces a statutory requirement for courts to make a formal finding of domestic abuse where relevant during sentencing. My amendments 30 and 31 introduce 2 procedural safeguards before a court can record that an offence involved domestic abuse. First, the court must have indicated that it appears the offence may have involved domestic abuse, And second, the court must have given an opportunity for the offender and the prosecutor to adduce evidence and make representations before coming to the view that an offence involved domestic abuse. These amendments... Yes,
Thank you, Madam Chair. I'm very grateful to the Chair of the Select Committee for giving way. He speaks about the indications of domestic abuse. Does he agree with me that particularly in cases of domestic abuse, which I've heard from constituents of mine, the importance in this bill of the resources being allocated to both the probation service and to electronic tagging is critical? The legislation allows for it, but would he agree with me that it's very important the government makes clear how it will adequately resource those two elements in order that victims of domestic abuse who will have this indicator to identify whether perpetrators have committed domestic abuse violence will be properly protected after the potential release of the perpetrator?
I do agree with that, and I'm coming on in a moment to talk about a new clause that deals with tagging specifically, and I'm rattling through because I've got a lot to do. But what I'm specifically talking about in relation to domestic abuse is simply that there is due process, which I think we would all want to see. So these are amendments to ensure that the requirements of this clause, which are important in allowing police and probation services to track domestic abuse perpetrators, are carried out in a manner which is as thorough and fair as possible. The next amendment, number 32, relates to clause 35, which amends the sentencing code to allow for the publication of the photographs and names of offenders serving community sentences. The explanatory notes say very little about this clause, but the justification in the Memorandum on Human Rights suggests the government believes this measure will have a deterrent effect on criminals, although there's little evidence for this assertion. The measure engages in the Article 8 right to private and family life of the individual, their victims and their family. Some concerns have been raised about how this measure may be operated safely in the modern social media age where photographs and names can be readily and quickly shared. My amendment prevents clause 35 from being brought into force until the Secretary of State has issued a code of practice to providers of probation services about how to take and publish photographs lawfully in the light of the Human Rights Act 1998 and data protection legislation. Before issuing a code of practice, Secretary of State must consult providers of probation services, lay a draft before Parliament and obtain approval from both houses. This will ensure proper parliamentary oversight of this measure. Yes, of course.
The honourable gentleman is indicating his diligence, as though any evidence of that were required with these technical but important amendments. But will he deal with the fundamental issue here? And that is that he will know the Criminal Justice Act 2003 from memory section 250 allows criminals that are released on licence to be subject to all kinds of conditions, as he's just said. But the truth is, if you let more dangerous people out, more people will be recalled, and they'll be recalled because they will have done immense amounts of harm. Recalls are going to go up as a result of this legislation, and many more people are going to suffer from those who have been let out early.
I've got quite a lot to say about recall, which I'll come to in a moment, but I always reflect on this. Licence is an established part, as indeed is the probation of the criminal justice system. Almost everyone, other than a handful of the most serious criminals, come out of prison at some stage. The issue of the public safety when people are released from prison is the one that this bill is trying to address. We may disagree on the means to that, but I'm sure we agree on the objective of it. Let me move on. I've tabled new clause 18, which relates to the provision of information to Parliament regarding offenders subject to electronic tagging and the operation of the tagging contract. The success of the measures in this bill rely heavily upon the use of electronic monitoring, primarily through the use of tags. The Justice Committee has continually raised its concerns with the performance of Serco, the government's current tagging provider. As a reminder, on the 7th of May, the Prisons Minister revealed to us that Serco had at that point received financial penalties for poor performance every month since they took on the electronic monitoring contract on the 1st of May 2024. Ministers have assured us that Serco's performance is beginning to improve. New clause 18 requires the Secretary of State to prepare and publish a report each calendar year on the use of electronic monitoring requirements. The report must include the number of electronic monitoring requirements imposed each year, the rate of compliance, and the cost of administering the requirements each year. The report must be laid before Parliament. This would, in about 1 moment, this would improve transparency and allow parliamentarians to assess for themselves how successfully Serco or other providers are administering tagging contracts. I'll give way.
I thank the Chair of the Select Committee for giving way. His new Clause 18 makes the point that the cost of administering the electronic monitoring requirements during the year should be released. Does he not agree that that should also include the size of the fine that's being imposed on them? When I've asked the MOJ for this, they have not been able to release this, and I think it is a matter of public interest to know what that fine is for their failures.
I'm delighted to see my friend is still taking a strong interest in these matters and remaining on the Justice Committee, even though he no longer has his front bench responsibilities. But we know he has other responsibilities that he wishes to take on. I entirely agree with him on that point. It's a point I think we've made in committee, and I hope the Minister is listening to it. I'm sure the words commercial confidentiality were used at some point, but this is not commercial confidentiality. This is us knowing about a very serious matter in the criminal justice system, how well electronic tagging is working, and that is very well illustrated by what the level of the fines imposed may be. I've tabled two new clauses, 19 and 20, regarding prisoners subject to imprisonment for public protection sentences. It has been 12 years since the last IPP sentence was handed down, yet around 2,500 people are still serving IPP sentences in prison. It's now widely acknowledged that the nature of these sentences has severe consequences for those who are serving them and their loved ones. New Clause 19 will implement the recommendation of the previous Justice Committee 2022 report that there should be a resentencing exercise in relation to all IPP sentenced individuals, and to establish a time-limited expert committee, including a member of the judiciary, to advise on the practical implementation of such an exercise. Yes,
I thank the Chair of the Select Committee for giving way and for talking to his clause, which has similar wording to the clause put down by the Liberal Democrats, which the Chair has indicated we may get a separate vote on. Does that mean that he will be voting with the Liberal Democrats and encouraging his backbench MPs to do the same?
It means that I will listen very carefully, not only to what the honourable member says, but also to what the government says. I know that the government is unlikely to do this because it's made its position on resentencing clear. I wanted to set out, nevertheless, that that is the best option, the most. However, I'm just about to go on to talk about other options, which I think might be more practical and which I would certainly urge on the Minister suggesting today. So we remain of the view that resentencing exercise is the best and most comprehensive way to reduce the number of IPP prisoners in prison, knowing, however, that the government is yet to be persuaded of the merits of resentencing on the balance of risk. I've also tabled new clause 20, which would allow a prisoner whose licence has not been terminated by the parole board 2 or 3 years after their first release to make an application annually to the parole board for termination. This would increase the opportunities for the licences of IPP prisoners to be terminated and would reduce the amount of time these prisoners have to wait in limbo between parole board hearings. In contrast to resentencing, this more modest amendment would enhance the process for IPP licence terminations. IPP terminations have been the single most effective measure in permanently reducing the stain of the IPP sentence. 28% of IPP sentences have been terminated by the parole board, ending the shadow of the sentence by cancelling it and removing the risk of recall for those who have been deemed safe by the parole board or complied with their licence for 2 years. The amendment would build on the success of this, or the new clause would build on the success of this process by reintroducing the right to apply for annual review that was removed by the Victims and Prisoners Act. At present, if a person's IPP licence is not terminated when the parole board first considers it, or if they had already had an unsuccessful review at the point when the Victims and Prisoners Act came into force, the only option for the licence to come to an end is when it will automatically expire after 2 years in the community without any recalls. Equally, the one-off nature of the current termination process means that victims are deprived of the opportunity to make representations between an initial decision not to terminate and automatic termination will simply be informed that the licence has expired automatically once a continuous 2-year period has been achieved. It's a technical amendment. It would have a significant effect and it would put the law back into the situation it was previously in many respects. I do hope the Minister will look at that and respond when he replies to the debate. I've also tabled an amendment and a new clause relating to recall and further release. Amendment 33 to Clause 26 gives effect to Recommendation 4.3 of the Independent Sentencing Review for stricter criteria and thresholds for recall. The bill as drafted does not deal with this aspect of the recommendation. A period of 56 days fixed-term recall is akin to multiple short sentences which have been acknowledged as ineffective and disruptive to long-term rehabilitation. This amendment puts into statute the requirement for recalls to only be used where there is evidence of consistent non-compliance or a specific and imminent risk of harm, as recommended by the review. New Clause 21 provides an opportunity for the current legislation for recall to be reviewed prior to the new legislation being rolled out to ensure it is effective and adequately protects the public. The sentencing bill was presented... I will just write on it.
Extremely grateful to the Chairman of the Committee. On another form of recall, I wonder whether he has any sympathy with my right honourable friend's new Clause 62 and the idea there should be a sunset on this, because however you look at the contents of this bill, it is a bit of an experiment, and looking 2 years on, making sure that we look at it, examine it, and if the circumstances require, renew it.
I think we have to do something about recall and do it now. The number of prisoners on recall has more than doubled over the 7-year period from March 2018 to 2025. Where it was 6,000 then, it's now 13,500. That's a significant part of the prison population. So where I am with the Honourable, I'm not going to give away again because I think I'm taking too much time, but where I do agree with him is that this is a difficult process to manage. And that's why, as I was saying a moment ago, the sentencing bill was presented on the same day that fixed-term recall 48, FTR 48, came into operation. FTR 48 is the recent provision mandating fixed-term recalls of 28 days in determinate cases of under 48 months. The new 56-day recall model recommended in the bill replaces FTR 48, with the exception that the default recall period is extended from 28 to 56 days. Prior to this new provision being laid, there had been no opportunity for the efficacy and impact of this model to be evaluated. This new clause would allow this evaluation to take place. So I think what I'm trying to do is the same as he is saying, which is we have to look very carefully and evaluate what the effect is. Because we're into new territory here, and there may be unintended consequences. The Sentencing Review received numerous reports that offenders are recalled for breaches, such as their tag running out of power or a failure to keep in touch, and that breach and recall processes are overly punitive and often felt to be unfair. As the bill stands, the legal test for recall remains unchanged. As more offenders were released at an earlier date and the use of electronic tagging will increase, there is a greater risk that people may be recalled where there are minor problems with the tag or housing issues. Tightening the legal test for recalls would confine its use to instances where there is evidence of consistent non-compliance or a specific and imminent risk of harm, as recommended by the review. Without this proposed amendment, there's a real risk the prison capacity crisis will not be adequately addressed, and we could even see an increase in recalls, albeit of shorter periods. A tighter test will guard against unintended consequences through the overuse of 56-day recalls. Amendment 34 to Clause 24 introduces the right to those being made subject to licence conditions to make representations as to their necessity and proportionality. This could be an important safeguard given the suite of new conditions in the bill that enables a wide range of restrictions to be imposed in the community. Without safeguards, the use of these conditions could lead to increased recalls and increased pressure on the probation and prison systems. Giving offenders an entitlement to make representations about licensing conditions will assist in alerting the authorities to any unintended consequences, for instance, where conditions might impact on resettlement or other outcomes, such as access to employment or health care. I am coming towards the end, but not quite yet. I come to the last of my amendments, Amendment 35, which relates to Clause 24 and concerns restriction zones. This amendment introduces a requirement for the Parole Board to have oversight of new restriction zones for offenders on licence. A restriction zone is, by its nature, highly restrictive and could potentially impact upon almost every aspect of an offender's life, including their ability to work, receive medical care and see family. Any application to leave the zone places an administrative burden on the authorities. This amendment introduces judicial oversight by the Parole Board of the extension of restriction zones. Parole board oversight of such conditions could act as an important safeguard before such restrictions are imposed, and may also provide an opportunity for victims to have a voice in setting out the potential impact on them before an independent body. This is the first time provision has been made to restrict offenders to a certain geographical area when released on licence without a requirement for judicial oversight or due process. The proposed restriction is akin to control orders, now replaced with TPIMs, but without the requirement for a gateway offence or judicial oversight. Finally, may I mention Amendment 36, which I have signed, which in the name of my honourable friend, the member for Colchester, is an important clarification of the powers of the court to impose a community sentence as an alternative to a suspended prison sentence in circumstances where this may offer a more effective prospect of avoiding future offending or breach of licence conditions. It's likely to be especially beneficial in keeping women out of prison. In conclusion, can I repeat my support for the bill and the government's approach to sentencing, which are the biggest changes in 30 years. I'd like to thank the organisations working with IPP prisoners, many of whom are relatives and friends of those still incarcerated, including UNGRIP and the IPP Committee in Action, and also thank Justice Union's Parliamentary Group, Prison Reform Trust, Law Society and Justice, among others, for their briefing and assistance with proposing changes to the bill. I hope the Minister will consider the amendments we've tabled to this bill as ways to improve its contents and bring clarity where it's needed, that he will respond to them in winding up and may even agree to adopt some. We survive on hope.
Shadow Minister, Dr Kieran Mullen.
Thank you, Madam Chair. I rise to speak in support of Amendment 24 in my name and the other amendments that I've tabled on behalf of the opposition. I want to begin by saying that I regret that we haven't had the opportunity to hear from important voices on these incredibly important issues through a full bill committee. I know victims groups of all different kinds care deeply about the measures in this bill. Not only do we not get to hear from them as MPs, but the nature of a committee of the whole House is that we also don't get the opportunity to put forward for inclusion a whole range of measures that are worthy of our consideration for a vote in support. Anyone reading the amendment paper will see the richness and range of ideas that just won't get the level of detailed consideration I think would have been beneficial. We may end up giving this incredibly important bill less than 15 hours of consideration in this House. I can't help but feel that the measures related to early release are so unpalatable that the government is doing its absolute best to rush this bill through the House to avoid proper scrutiny. But, Madam Chair, I want to try, though, and at least give some time and thought to some of them, even if ultimately we will not be able to vote for them. Amendment New Clause 12 relates to changes to the Unduly Lenient Sentence Scheme, or ULS as it's known. At present, the ULS allows anyone that wants to appeal most sentences to the Attorney General's office if they consider them to be unduly lenient. I and other members of this House have made use of this scheme, as have others. They can and do lead to sentencing being changed. But there are two major problems with the scheme as it operates at present. Too many victims are unaware of it and they don't get long enough to make use of it. At this point, I want to pay tribute to the amazing campaigners who've done so much to raise this issue. Katie Brett, who secured thousands of signatures to a petition to change it in memory of her sister Sasha, and Aisha Hussein and other members of the Justice for Victims group. This has also been raised for many years by Tracy Hanson, who I had the pleasure of meeting recently in memory of her son Josh Hanson, who was the victim of an appalling murder, and I know there are other campaigners similarly inclined. All of them are clear that the current scheme doesn't work. Our amendment will require the CPS to notify victims and also extend the time available to appeal for up to a year for victims and their families if the victim is deceased. This is... I will.
I'm grateful to my honourable friend, and I pay tribute to that campaign, and in particular to his commitment to victims, which I know is outstanding. Will he acknowledge too that many of the people who suffer at the hands of repeat criminals, career criminals, and sometimes people have been let out on licence, and those licence conditions are breached. A young woman killed by a dangerous driver on licence who was banned from driving, for example, in my constituency. There are many like them, and I know he's standing for them. Will he therefore press on this government that they are letting people out who will cause grief, harm, hurt? That's just not good enough.
the honourable member is right in saying that we can do what we want when it comes to putting conditions on people and expecting them to behave differently. But the only place we can be sure that they are not out committing further offences is in prison. And across the board, this measure is going to let out, and I'll go on to focus on this towards the end of my speech, very many serious offenders out of prison earlier. As I was talking, in terms of the unduly lenient sentence scheme, the government has previously said it will await the outcome of a review into criminal appeals, a review that's already said that the system is working fine, and for which we have no timetable or plan for the implementation of its recommendations. The opportunity to make this change is now, and I would encourage ministers to take it. Our amendment, New Clause 8, relates to what are quite clearly unacceptable restrictions on what people can say in victim personal statements, often referred to as impact statements. This is another issue that the Justice for Victims group and others have raised. The parents of Sarah Everard, Susan and Jeremy are very clear that those people advising them on their statements were doing their best to act in their best interests and to help secure the best possible outcome for justice for Sarah. But the system and the rules around this are leading to too many people like Susan and Jeremy being told they can't say what they should be allowed to say. Glenn and Becky Ewins, also from Justice for Victims, had the same experience when making statements about their feelings towards the vile criminals that killed their precious daughter, Violet Grace. Our amendment will ensure the government can help victims get the best possible opportunity to say what it is they want to say, whilst recognising this statement is still being made in a court. Our amendment, New Clause 16, is aimed at closing a loophole that I think all members would agree needs to be closed. Our current sentencing laws require a whole life order to be passed for those that murder a police or prison officer in the line of duty. That is an important deterrent and enables the delivery of justice for people that put themselves in harm's way dealing with violent criminals should the worst happen. But it's clear to me that the courts have not interpreted the meaning of that legislation as I and I think most members would have wanted them to. In 2024, former prison officer Lenny Scott was murdered. He was murdered by a serious, violent criminal for doing his job as a prison officer. Lenny had bravely stood up to threats from this criminal whilst he supervised him in prison, as he reported that he had contraband. Years later, this despicable person came back for his revenge. He was convicted of his murder, but the courts decided that the whole life order tariff did not apply because he wasn't actively on duty when the murder took place. I think that this is contra to the spirit of the measure, and our amendments seek to correct that loophole and ensure in future if a prison or police officer is murdered because something they did in their role, whenever that might be, the sentence will be a whole life order. And out of all the measures that we're putting forward, I would imagine that would secure the greatest amount of cross-party support, perhaps not at this stage of the bill, but in future stages in the Lords. Our amendment, New Clause 10, supports greater transparency in our justice system by ensuring sentencing remarks in the Crown Court are available for everyone. And transparency is also at the heart of our amendment, New Clause 9. For too long, for the wrong reasons, we have not been transparent about the backgrounds of criminals. We know that political correctness led to the vile grooming gang scandal to go on unchallenged in the way that should never have been allowed for many decades. Part of the issue is that we did not have the data, the information to understand what was happening and who was committing those offences. Why should we not know basic information about criminals that enable us to have an honest debate about different patterns of criminal behaviour in different communities and different parts of the country? Especially when we know if we refuse to do this, if we refuse to be transparent, all we do is give fuel to the wrong people. At best, indifference to the need to share this data is looking more and more like a desire to cover up what it might reveal. This has to stop, and our amendment will ensure that it does. Amendment New Clause 11 relates to steps the court should take to limit parental responsibility for those convicted of child sex offences. I know in the last Parliament that this is something that the member for Meriden and Solihull East campaigned on in support of a constituent who met with the previous government's ministers to discuss it. And in this Parliament, the member for Lowestoft has joined this campaign along with other members. I understand that yesterday the government laid an amendment in the related Victims and Courts Bill due for further consideration. Of course, we'll look closely at that to consider whether it meets the reasonable expectations of parents seeking to protect their children from child sex offenders. New Clause 13 and 14 are also related to child sex offenders. As I've said, I will go on to talk about the wider plans to releasing offenders earlier, but at the time the government first announced those plans, they made an obvious attempt to distract the media from their actual plans by giving the impression they were going to introduce mandatory chemical castration of sex offenders. What they've actually pledged to do is nothing of the sort, but we intend to deliver where they have not. We want to ensure, when appropriate, that courts can impose this and make sure there are consequences for offenders that don't comply. They have pretended to do whatever is necessary to help reduce the risk posed by child sex offenders. We actually will. Our amendment, New Clause 14, relates to our broader intention to reform the accountability of our justice system. We begin by restoring accountability for the provision of sentencing guidelines. We saw how the Sentencing Council was intent on introducing two-tier sentencing guidelines in this country and resisted all attempts to stop them doing that. Too many organisations have become disconnected from public accountability. They think simply putting something on a website or holding focus groups means they understand what the public want and are accountable to them. That is not accountability, and we will lay out in coming years a programme of reforms to ensure whilst the judicial establishment retains their independence where it's vital to its successful operation, that is not sat in an ivory tower separated from accountability to the wider public which it serves. And I would say to members of Reform that this amendment is a good example of how it is not enough to just be unhappy with the status quo. You need a proper plan to address it. Their new Clause 24 abolishes the Sentencing Council, but without anything to replace its functions. If we can't issue sentencing guidelines, victims have no realistic basis against which to challenge shorter sentences. New offences could be introduced without any way of the courts understanding the expectations on sentences for them. I would also like to speak in support of the amendments by the Right Honourable Member for Tatton in relation to suspended sentences. I think she did an excellent job of laying out the deep, deep flaws in the government's plans, which I agree are being driven by ideology and belief rather than reality. I think the amendments in themselves demonstrate just how many ways in which these measures are not sufficiently robust, with so many gaps and loopholes that amendments from the member are seeking to address. Let's be clear, the courts already do everything they possibly can to avoid custodial sentences. They are actually required by law to set the minimum sentence possible that still meets the interests of justice. There is often a confusion about what is described as the impact of short sentences. Association is not cause, but it seems many people do not understand that. Short sentences are frequently imposed on recurrent, prolific offenders for whom community measures have been tried and not worked. By definition, they are a challenging cohort. Comparing their reoffending rate with the reoffending rate for offenders receiving community sentences is very misleading. When you do the more detailed work of comparing like for like in terms of offending history and other characteristics, the difference in reoffending rates falls back dramatically to single figures. Offenders receiving short sentences deserve to receive them. Very many of them are individuals that assault emergency services workers. As the member highlighted powerfully, this was something that members on the opposite benches in opposition said was a priority and intolerable. Why should they escape punishment in prison? And I welcome that the member has drawn specific attention to this with her amendment and speech. I will.
I'm extremely grateful. And he's now coming to the nub of the issue, because there are different views across this House. There are those of us who believe that the justice system should be retributive, that punishment matters, and that punishment should fit crime, and there are those who don't. Those who don't think the justice system should be punitive. I think it should be punitive. More people should go to jail. It should go for much longer, and not just because it's a deterrent, because it signals public outrage at these heinous acts. That's why it matters, and everyone in this House should realise it.
The honourable members frequently raise this issue, and I think we're in violent agreement that, and actually, in my experience, there is an intellectual snobbery towards people that think there is moral value and an ethical basis for punishing people and punishing them properly. And anyone that talks about that, you often get labelled as some bigot who doesn't understand the patterns of criminality and all these other things that, of course, are important to consider. But none of these things mean that we shouldn't be appropriately punishing people. And it shocks me that still remains actually not part of the statutory purposes of sentencing. Actually, just punishing people is important, and we don't consider it enough. And so for all these reasons, this bill is incredibly important. Today is incredibly important, but it's also important for another reason. Today is the last chance for this place, for backbench MPs, to decide for themselves what parts of this very significant sentencing bill they will support. Next week we'll have the third reading, where Labour MPs will have no choice but to vote for or against the entire bill. We know a major part of this bill is the earlier release of nearly all offenders. The opposition is opposed to the programme. Sorry, I thought I had someone ask me to give way. The opposition is opposed to the programme as a whole, But it is clear that as a whole, this is a major part of the government's plans to reform sentencing, and it would be asking a lot of Labour MPs to ask them to consider voting against the entire programme. But we are not asking Labour MPs to do that. Our Amendment 24 gives Labour MPs the route through which they can most justifiably say to their whips and the Prime Minister, no, I can't support this. We are asking them to say no and to vote against releasing rapists, paedophiles, seriously violent criminals, criminals that cause death by dangerous driving and attempted murderers earlier. We are giving them a clear route out of doing what would be absolutely unprecedented for the management of offenders in our prisons and a deep, deep insult to the victims of serious violent and sexual crime. Labour MPs, many of whom I've gotten to know, worked with and respect, will know I have spent the last week trying my utmost to encourage them to avoid being put in a position where the whips will make them vote to release rapists, paedophiles and serious violent criminals earlier. Most shadow ministers would happily sit back and watch Labour MPs vote for something that will blight their time in Parliament in the eyes of their constituents, but they haven't done that. That is because whatever damage voting for this might do to the electoral prospects of Labour MPs, what is more important to me is that these measures do not go through. As I've spoken about before, I understand frustrations MPs have had cross-party over decades about the resources provided to our justice system and the prison estate. I mentioned this in the second reading. When Labour were last in power, they released more than 80,000 prisoners early because of capacity issues built up during their time in office. This government and the last government has operated similar programmes. I wish these emergency release measures never had to be used, and if, and this is a very, very big if I'd ever been Prime Minister or Chancellor during these periods, I would have taken different decisions. But at least these measures have to be announced in the full glare of the public eye. They carry a political price and are genuinely legislated for as responses to short-term emergency challenges. I want Labour MPs to be absolutely clear-eyed about the fact that what we are voting on today is not a short-term response to prison crowding challenges. It's a medium to long-term plan, a decision about how we as a country want to respond to people that commit serious, violent and sexual offences. I have never met a victim of a serious, violent or sexual offence who thinks that the present system suitably punishes serious offenders. I have never met a victim who thinks that what we should do is let these sorts of people out of prison earlier. But that is what this bill will do. During second reading, I explained the sorts of offences that will be included in these measures. Ministers have said the very worst offenders will be excluded. Since second reading, the opposition have been able to review sentencing data to try and understand what that means in reality, and it highlights a disturbing truth and leaves the government and any MP that votes for this with a difficult question to answer. Those serving extended determinate sentences and life sentences will be excluded from the early release elements of this bill. Those serving standard determinate sentences will not. Prisoners on standard determinate sentences will have their prison time cut. On average, every year, more than 60% of criminals sent to prison for rape are on a standard determinate sentence. Over 90% of criminals sent to prison for child grooming are on a standard determinate sentence. Around half of criminals sent to prison for attempted murder are on a standard determinate sentence. Hundreds of criminals guilty of child rape and sexual assault, including rape of children under 13, are in prison on standard determinate sentences. In total, more than 6,500 criminals sent to prison every year for serious, violent, sexual and other offences are given determinate sentences. If Labour MPs vote against our amendment today, every single one of these criminals will be able to get out of prison earlier. Labour MPs will be voting to let rapists and paedophiles out of prison earlier. Yeah. The Minister shakes his head. If he wants to intervene and explain why that isn't the case, then he can. No, he's not going to.
Come on.
And let's be clear, that's not on a retrospective basis. When the measure is enacted, from that point on, every criminal in prison at that point in time will be able to benefit from these measures. That is thousands of serious criminals. And it's very clear to me that what is being said by ministers, and I anticipate they'll say later, in defence of these plans, is in danger of misleading MPs. Yeah. Because as it stands, Labour MPs will have to vote in support of the government's position that the most serious offenders are excluded. I would invite MPs to reflect on how the Justice Secretary can possibly say any rape is not one of the most serious offences, let alone hundreds of them. Will Labour MPs that vote against our amendment tonight be able to say to survivors of child sex abuse that they supported a government that wanted to classify thousands of child sex offences as not being the most serious offences? They've also said that these earlier releases have to be earned by good behaviour. That is simply not true. I appreciate it can be difficult to always believe what MPs from opposition parties are telling you, but MPs do not need to take my word for it. The House of Commons Library briefing note on this is there in black and white for everyone to read, and it says, and I quote, "As currently drafted, the provisions of the bill do not bring in any new criteria for people to adhere to prior to being released at 1/3 or halfway point, or any discretionary elements to release." I'll repeat that. Do not bring in any new criteria. Labour MPs also need not look any further than emergency measures and contrast them with this permanent long-term change to find the evidence that this approach by the government is totally unprecedented. The SDS 40 scheme and other schemes that have come before and sat alongside it have many more exclusions, for example, sexual offenders, yet this permanent, non-emergency approach does not. What ministers have said about this, what they have been telling Labour MPs to secure their support, is not accurate. That should always make backbench MPs wary. If the government is making inaccurate statements about what a measure in a bill does that they want MPs to support because they can't face the reality of what it does, then MPs should think very carefully about voting for it, because there's no going back. You will have to defend that decision. This morning I emailed every single Labour MP the library briefing note so they could see this for themselves, whether they listen to this debate or not. Ignorance will be no excuse, because today will not be the end of it. I guarantee members the harsh reality is history tells us that some of the criminals Labour MPs are being asked to vote to release will almost certainly commit further serious offences at a time when they would otherwise have been locked up. Yep. MPs will then have to explain why they voted for non-emergency changes that let them out earlier. I would not be surprised if one of these cases is sufficiently serious that the government amends these measures in future in response to a public backlash. There is every chance they will make Labour MPs go through the lobbies tonight and make them vote for the indefensible and then at some point pull the rug from under them. I appreciate a lot of the members opposite are new to this place. They can speak to longer serving members about how that then makes them look as MPs when they're forced to follow a line that is later withdrawn. So I've made the position clear. I've set out the consequences. MPs voting against our amendment this evening will be voting to reduce jail time for extremely violent criminals, paedophiles, child groomers and rapists. Right. I've done as much as I can to stop that from happening. Ministers are resorting to saying things about the measures that are inaccurate to secure support from their backbenchers. Don't let them get away with it. We've set out clearly how our amendment will ensure that appalling criminals don't see their punishment cut. I know it's difficult as a backbencher to stand up to the government and say no. I know it is. But if we don't, thousands of the worst criminals will get out of prison earlier as a result. Labour MPs now have to decide whether they vote for what victims of child abuse, family members of people killed by dangerous drivers, victims of rape and others want, victims that I know many of them care about, or what the Prime Minister and his whips want. Tell the Prime Minister no, tell the whips no, and vote for our amendment tonight.
Graham Morris.
Thank you very much, Madam Deputy Chair. I'm going to try and make my remarks fairly brief, not because I'm against short sentences, but because I do recognise there are time pressures on the debate. Essentially, there are 3 amendments to the bill that I'd like to record my support for, and they're in the form of new clauses 2 and 3. I might say I did agree with virtually everything that my good and honourable friend, the member for Hammersmith and Chiswick, said in his remarks a little earlier in this debate. I do want to place on record, Madam Deputy Chair, my thanks to the Minister, my honourable friend, the member for Rother Valley, and his team for their engagement and time, both before and since second reading of the bill. My intention is to support this bill, but also to seek to improve it. On that basis, I've had extensive discussions with the justice unions, notably the Prison Officers Association, the probation officers, the National Association of Probation Officers, prison educators, the UCU, and indeed the PCS union. and I've added my name to new clause 2, tabled by my good and honourable friend, the member for Liverpool Riverside, which seeks to ensure that the probation service, not Circle or any other private company, oversees this increasingly important criminal justice technology, as is the case in almost all of Europe. And that's the key to the success of the bill, the tremendous opportunities for this new generation of electronic tagging of offenders. This clause also ensures that it is not the responsibility of an already overstretched prison service to tag offenders before release, not when Circle are being paid handsomely for this contract, and as my honourable friends already pointed out, contracts that were awarded by the previous Conservative government and for which Circle, as the provider, have suffered considerable financial penalties. I'd like to pose a number of questions to the Minister, which I hope he might be able to respond to, either in his remarks or at a later date. Does the Minister agree with the National Association of Probation Officers and the Prison Officers Association that with such a huge expansion of electronic monitoring as envisaged by the bill, the safeguards set out in clause 2 are sorely needed on the face of the bill, and that we urgently need a full debate on whether we want public or the private sector in operation control of electronic tagging. Secondly, I also want to pay tribute to my right honourable friend, the member for Dewar Meonith. I hope I've said that correctly, and thanks to my honourable friend, the member for Ceredigion Preseli, for coaching me in the pronunciation, for tabling new clause 4, to which it is work in progress, to which I have added my name. This amendment calls for probation to receive a clean bill of health by His Majesty's Inspectorate before any increase in pressure on the service. It also provides a much needed power to trigger what's called a prioritisation framework. So if there are serious concerns about a particular region or unit's capability, so that probation officers can focus on the high risk cases instead of on non-essential tasks. And again, I'd like to ask the Minister, does he... I'll give way very briefly because I'm conscious that...
John Gentleman, who is an old friend, and I appreciate his attempt to improve the bill. His new clauses are interesting and have merit. But would he just acknowledge that it's not just probation services that will put under extra pressure by this bill, the police will too? And I wonder if you invite the Minister, when he sums up, to talk about the extra resources that he can make available to Lincolnshire Police and other authorities, as well as to the probation service, to enact the provisions of the bill that he's bringing to the House.
Yeah, I'm grateful for that intervention. I think it's quite sensible, and I support the contention. I hope the Minister will respond appropriately when he has the opportunity. I'd also like to ask the Minister if he agrees that the inspector, that's the HM Inspector of Prisons, should have the powers outlined in this new clause, and that they're just the sort of safeguards we really need to see on the face of the bill before more pressure is placed on the probation service. And we're all aware that the probation service is really overstretched, principally as a result of funding cuts implemented by the previous government and some of the decisions that were taken before the present government came to office. Finally, Madam Chair, I'm also pleased to register my support for new clause 3 in the name of my good and right honourable friend, the member for Hayes and Harlington, and I'd like to echo his concerns that he expressed at length in second reading about the potential for exploitation by private companies, such as when unpaid work in London was privatised in 2013, and indeed this was criticised by the International Labour Organisation as an abuse. And again, just finally, could I ask the Minister, does he agree with the probation unit, the probation union, NAPO, that unpaid work orders should always be about pay back to the community and run for public good, and not for private profit, and that this safeguard should be placed on the face of the bill. Thank you.
Liberal Democrat spokesperson Jess Brown-Fuller.
Thank you, Madam Chair. As the newly appointed Justice spokesperson,
everyone's a bit moving. It is, but then also the club are like so erratic that everything writes itself. We haven't got to go around. Yeah, but like, I guess it's like when and jump, like from the first, it would probably like have to fight back from the and I guess like yeah, I suppose yeah. But I think, and I don't mean this in any discussion anyway. I think it's very well. I would think Anne probably has to do less of that chasing lines, which he would have had to do. And some just sort of possibly out to the breaking news. I guess. And obviously you need to get cut off that, but then kind of let it go out there, isn't it? So I suppose it's then just a case of like she just freelancing these days for your report, as opposed to you trying to get the exclusive, or do you know what I mean? Yeah. Slightly different way of working, isn't it? So. Did she get to work with us recent boss? Oh, no. Oh, sorry, first, yeah. He gets to work with Callum quite a lot now, doesn't he? Oh, yeah. Yeah, he was talking about it. Is Wendy still there? I thought she left, but I don't know. Wendy Taylor still at Forest. I don't know, yeah. Yeah, we were talking. How does...
This stuff yesterday was just crazy.
Whereas because you hated West, like Amy was having to like call West Ham up there.
Okay.
So like trying to when you were like jumping in to right.
That's cool. Guys, welcome back. Thanks for joining us at St George's Park ahead of this international window. Very pleased to be joined with Esme. Kirsty, we'll begin with you at Sky Sports, if that's okay. And just a reminder, this is a live press conference. Cool. 3 or 4?
Okay. Well, first of all, how does it feel to be here, back?
Good. I mean, it's nice seeing all of the branding which says European Champions 2022 and 2025. It's pretty special, and even just then walking through the main entrance and seeing the trophies with the picture of the lift behind it is just brings a smile. It's really nice to see everyone and be able to reminisce over fun little moments that we had, mostly away from the pitch is what sticks out, but it's just nice to catch up and be able to enjoy and celebrate what we achieved.
Because you didn't get much chance to celebrate, did you? You were, not long afterwards back on the plane to the US with the season still going on. So I guess a bit more chance for you to reflect back.
Yeah, it was a bit surreal. Like, I flew back the day after the parade, so going from being on a bus in front of 65,000 people down the Mall to then just feeding my cat again was like swift come back down to earth. But it was a lot of fun, and I enjoyed being back because all the girls in America are so lovely and really celebrated it with me and made me feel special. But yeah, it's nice to be able to come back here because it kind of brings home what happened, because obviously I didn't have much time to let it sink in, so it's been fun.
And I guess now it's all about looking to the future. We know, though, that future will be without Millie Bright. What were your feelings on hearing the fact that she is retiring from international football?
Yeah, I was sad. I love Millie so much. She's such an incredible teammate. I remember when I first came into the squad, she made me feel so welcome, really made an effort to get to know me and help me feel included and settled and a part of it. And she's an amazing player too. I always say she's a rock because she's such a reliable, dependable presence at the back, and we're going to miss her a lot. I feel very, very grateful to have been able to share time in the England squad alongside her, to be able to create memories together and learn from her both on and off the pitch, in the way that she carries herself around the team, the way that she fights for things to be better, and has a lot of passion for everyone in the squad achieving their best. And so I've enjoyed learning from her in that sense. And then on the pitch, she's such an incredible defender. So I feel like I've taken a lot from seeing that up close too. So yeah, we'll miss her a lot and just want to congratulate her on such an incredible career, really.
And in terms of these games coming up, the first of which against Brazil, how important do you see these games and how special that this first game is at the Etihad, a chance for you to go back to your old stomping grounds?
Yeah, it's very exciting for me being a lifelong City fan. It's should be a great occasion. I think it's a special time for us to be able to come back and be in front of our fans again and celebrate what we did over the summer with those who possibly couldn't have got out to Switzerland themselves. So we want to carry on the joyful feeling that the summer created and put in some good performances, hopefully get some good results and, as I say, just keep that happy momentum going.
Great stuff. Thank you.
Thank you.
Thanks, Kirsty. We'll go to Emma at BBC. Thanks.
Hi Esme, nice to see you. You were talking about reflecting on the Euros win. I just wonder if you had time to reflect on your own performances, because I thought you really stood out and performed really well in the tournament.
Thank you. Yeah, a little bit. I think when you're just in the games, you kind of just put one to bed and then go on to the next. So not too much, but I felt really good going back to club off the back of that, feeling confident in my performances and the way I was able to contribute in those latter stages, and feel really proud that I stayed ready through the tournament so that I could make an impact in the quarter-final. So yeah, I was really proud of it, and I feel like it gave me a big boost going back into club, and I've sort of carried that momentum then since.
Yeah, it's obviously going to be a big sort of year and a half gearing up for the Women's World Cup as well. And without Millie obviously being around, Leah's injured for this camp, I suppose it gives someone like yourself a really good opportunity to cement your place in the starting 11 towards 2027.
Yeah, I think I approach every camp the same way and have done ever since I got into the team. It's just a case of performing consistently at your highest level at club, and then once you come into camp, demonstrating that as well, and then everything else is obviously up to Serena. You can only prepare yourself in the best way possible, and I feel in a good place right now, but the rest is out of my control, and I always just come into camp and do the best job that I can in whatever role that I'm given.
What would you say your strengths are, do you think?
I think on the ball, I'm someone who can help the team progress up the pitch. I'm athletic to be able to defend against dangerous forwards. I think I read the game well, but most of all, I like to think that I'm a good teammate and someone who can help bring the best out of others as well.
Thanks, Esme.
Thanks, Em. Go to Kit at the Times.
Hi, Esme. Nice to see you. Obviously, the last few England camps, there's been a very clear focus, which would have been about the Euros or preparing for the Euros, whereas now, I suppose you're about as far away from a major tournament as you can get. When we're at kind of, I suppose, this stage of a 2-year cycle, is it easy to kind of reset and go again, or is there a little bit of a come down you have to deal with?
I think generally post-tournament there's a little bit of a come down because you've achieved a dream. Certainly I felt that going back to club a little bit was, wow, like it's hard to want to keep going and going again when you've achieved something so much, but then you re-find the hunger to want to win because it's such an infectious feeling. So already now our focus is shifting to the World Cup. Serena said yesterday there's only 10 camps until the World Cup, which actually when you think about it doesn't feel like that many. So we know that we're reviewing our performance at the Euros, picking out areas that we can do better, that we need to do better, because every single tournament the level goes up and we know that other teams aren't standing still, so we can't either. And so we're going to keep pushing ourselves to improve while having that fighting spirit to always keep going until the end and never give up, because as a foundation that's something that is incredibly special and that can take us a long way on its own. So if we can refine other areas of our game, then that stands us in good stead for Brazil, and we're already looking ahead to that.
Yeah, I was going to ask, like, how much are you looking ahead to the World Cup? Because it does almost feel like it's the one thing left for this team to do. You've won Euros twice, you won the Finalissima. Is it already then something that's kind of at the forefront of your minds as a squad, 2027?
Yeah, I think the World Cup is the absolute pinnacle. Everyone wants to be able to look back on their career and say that they've won that. So definitely with this squad that we have, everyone's so competitive and has such a desire to win. That's something that we're so used to football being a cycle of you do something, you put it to bed, you move on to the next thing. That's how we live. And so it's only natural now that we look at the next major thing, which is going to be the World Cup in Brazil, and turn our focus to how we can best get there and be prepared to be at our best there to win.
And just, you've talked about like going back to America and going back to playing at NWSL. Since you've been playing in the States, kind of, how do you think your game's improved? What does playing, or how does playing in the NWSL make you a better centre-back?
I think I've been able to challenge myself on a week-to-week basis through playing consistently against lots of different types of forwards. You've got people like Esther, who are very intelligent in their movement, like to drop in and link play, and in and around the box she's incredibly clever with the positions that she takes up. And then you've got players like Barbara Banda, who's a powerhouse, and you have to recognise when the opposition are looking to get her the ball and kind of drop off and give her a little bit more space because she's so quick. So I feel like having those tests against different types of forward has allowed me to be challenged in the games and then watch them back,